You're unmuted.
You see a box.
And the next day,
I told you.
there's a picture of Zoom.
Sure.
We were sitting down. Okay.
She was just saying, it's asking.
You know you're unmuted.
I put it down.
It was it was one of those like skin colored spiders. I couldn't see it.
All right, I'll call the meeting to order. The Board of Commissioners and the Frank Walter House Boardroom for June 9th, 2026. Could we have roll call, please?
Janat,
Yes.
Markey,
Here.
Matthews,
Here.
Nye,
Here.
Roloffs.
Here.
Sauer,
Here.
Trigg is excused.
All right, if you'd stand for the invocation and pledge, Lynn, if you would.
Okay, please join me. Dear Lord, we ask you to look over this organization, Lord, and in the tradition of our country, first established in 1774, the First Continental Congress that was started with a prayer, Lord, and even through George Washington's first acceptance of his position as president, began that with prayer too. So it's a long tradition that we follow 250 plus years later, Lord, that you look out for us, that you give us the wisdom and discernment to make sound decisions benefiting our fellow Benzie County citizens. In your holy name we pray. Amen.
Thank you, Lynn. I pledge allegiance
To
the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Very good. You had the agenda in advance of the meeting. Is there any comments or changes on the agenda?
I had to correct Dan Thornell's last,
You spelled it correctly?
I did not spell it correctly.
Okay, consider it changed. Anything else? If not, I'd entertain a motion.
I move to approve the agenda as presented.
Thank you. One more shot at it. If there's no comments, all those in favor signify by saying aye.
Aye.
Opposed, same. You have the minutes of May 26th in advance of the meeting. Any comments on those?
There is one correction on that, and the county administrator's report, the word no should have been not. But
Very good. Anything else? Not hearing any comments, entertain a motion.
I move that we approve the minutes 5/26/26 as amended.
That'd be Len, support? Gary? There's no additional comments. All those in favor signify by saying aye.
Aye.
Any opposed? All right, let's move to our first public comment at 9:02. Is there anybody from the public that'd like to address the commissioners? Seeing none, we'll close public comment and move to elected officials and department heads. Katie, I think there's an order that you want to go in.
There is. The first department head I would like to call up is Rachel Wilson. Rachel Wilson, I don't think you guys have met her since she started with Benzie County. She is our Deputy Director of Central Dispatch, and she is filling in right now while we work through the process of bringing on a new director. But she does have a special announcement to give to the board this morning.
Very good.
Yeah.
Hi, everyone. I'm Rachel Wilson. Like Katie said, I'm the Deputy Director of Benzie Central Dispatch, and today I want to recognize one of our dispatchers for Dispatcher of the Year. Dusty is someone who is always willing to help and support her coworkers whenever needed. As a CTO, she has played an important role in training and guiding our new dispatchers, sharing her knowledge and her experience to help them succeed. Her positive attitude, willingness to assist others, and dedication to our team make her deserving of this award. Congratulations on being named Dispatcher of the Year, and thank you for your 14 years of service to Benzie County.
what would come on?
And Rachel, for the record, could you give us a name again, please?
Dusty,
Hey, Dusty. Congratulations, Dusty.
And then I'll give a little bit of an update during my admin update as to kind of where we're at with the director position. But the second department head I'd like to call up, and then there's no order after this, is Joe Duncan. Joe Duncan is our new animal control director. So I'll invite him up to the podium to introduce himself and give a quick 1 minute on him. And then he's got work to do already. So he'll be headed out.
Good morning. I'm Joe Duncan. I come from the Tacoma, Michigan. I was a field operations supervisor for Saginaw County animal control. I have experience in public safety. Super excited to be up here. I've been wanting to come up to Northern Michigan for a long time, and I have family up here, so super excited to be up here.
Great.
Thanks.
Welcome.
Let's open it up before you get out of here. Just very quickly, questions from the commissioners. Gary?
Just have one. Did he find a house?
Trying.
Not yet, not yet. I'm staying at a family friend's place. So
If you know of
Welcome aboard,
anything,
Joe.
send
thank
us.
you.
Yeah, thank you.
Thanks, Joe.
We'll look forward to your first full report next month, okay?
I don't have an order after that, so any other department head
Open
or
it up to
elected
department
official.
heads and elected officials then.
Good morning, Kelly Long, County Treasurer. Let's give you an update on what's going on in my office. Of course, it's June, so we're getting ready to do our tax bills for the summer of 2026. And let's see, we had a treasurer's meeting last week with all the treasurers. I had 4 entities that did not come, but that's pretty good. We had a great meeting. Independent Bank was our sponsor. They taught the gals and gals. I don't think I have any guys. About fraud, what to look for. So that was really great. We enjoyed that. Talked about a lot of different topics. Had a good long meeting. It was really good. And I've gotten quite a few emails back from people thanking me on that. So that was awesome. We also talked about the cloud. We're getting ready to update to that here at the end of August. We do have 4 villages and 5 townships / our city on the cloud right now. I was pleasantly surprised. So that's a good thing. The BSNA is willing to offer the last 8 townships a discount if they're willing to all go. At least 5 of them are willing to go together on jumping on board. So we'll see. I talked to all of them, and there's a few out there that are interested. So we'll see what happens there. I know with the BSNA, we had Discovery last week. Last Tuesday, we talked all day about different things. And they sent us, it's called BSNA University Academy. That was sent out to most of the department heads that have BSNA. Please sign up. It is a tool to use to train with. So if you want to learn what you're going to do before it gets here, it's a really great tool. That was sent out, like I said, to all department heads, and those, I know the 2 in my office got it and a couple others. So please, those of you out there listening, if you got BSNA, go ahead and sign up. I haven't had a chance yet. I'm going to do it and see how it works. Let's see what else we got going on in my office. Oh, the last thing right now that I've got is those little pamphlets I hand out to you this morning about the Wayside Church settlement. That is a list of people that did file claims. That's not all the claims that occurred from 2020 to 2013. Those are what were filed. I've put them in order of, the yellow is meaning single, is there's 1 person that filed a claim. The green is duplicate, meaning there was more than 1 person that filed a claim on those properties. The first one, the single, we are expecting to pay out by the 15th of September. And there's 2 different prices there. I'm expecting the smaller of the 2. We'll see what happens once I get final numbers. The duplicate claim isn't until August of next year because they've got a lot to work on. And then on that second page, there's potential claims that they're still working on. One's a single, one's a double. There is a potential of another $250,000 being paid out in September. We'll wait and see. I have gone through the list and double checked everything. They are all legitimate claims with all the proper people and banks in place. So my deadline was June 15th to get that back to them, and I did. And I'm hoping to hear something here by July or August on final numbers. But wanted to give you a heads up on that because we'll be discussing a amendment here coming up.
We
Any
prepared
questions?
fully, we prepared fully for this payout, right?
We did, yeah. I know the state of Michigan does have, they are looking to appropriate maybe up to 25 million to help out 83 counties, which it's not a lot, but it's help. I don't know how much Benzie might get. It'll be a small percentage, but there's always that potential that the state will come out and help us with some of this
Usually
too.
help the ones who didn't prepare.
Typically.
Yeah, typically. Yeah. So we'll see. We'll see. But yeah, I think we're in good shape to cover what we need to cover, and it's a lot less than what I anticipated too. So, and we've got the next 1.5 to 2 years before we finalize all this. So,
Just to follow up what was said a moment ago, so we potentially could get penalized for doing the right thing.
Yes.
possibly, yeah. I mean,
Ever heard of MERS?
Other questions or comments?
I do have one. I'm just a little confused. Duplicates? Does that
So
mean
that-
more than one person filed?
correct.
And
So,
who decides who gets what?
well, the courts are going to make that
Courts
final
make the
decision. What
final
will happen
decision.
is they're going to say, okay, we've got 3 people that filed a claim on this one and they're all legitimate claims. So the court might divide it into 3 equal parts. They might say, well, I'm going to give the owner 50% and you two 25%. And it all depends on the banks. How much are they looking for? Is
A
it
lot
the
of
pay?
these people here are banks.
Some of them are. There are quite a few the duplicates are banks, which kind of surprised me because you'd think the bank would have saved it from getting foreclosed on. But maybe it's just a small amount. I mean, what if the claim is 50,000 and the bank only needs 10? They'll pay out the bank and give the rest to the other person, potentially.
Curious how they
Yeah.
factored that in. Thank you.
All righty.
Questions or comments? Kelly, then quickly, is your office getting many comments or questions regarding the ballot initiative for the village in August?
We have not yet. No, not really.
Right, I'll ask that question probably every
Every
meeting
month.
between now and then.
Sounds good.
All right, thank you.
Yep. Thank you.
Morning. Rebecca Huber's Office of Emergency Management. Been a couple meetings since I've been here. I'll give you an update of the state of emergency. 2 meetings back, I rushed out of here pretty quick to meet with FEMA and Small Business Association. We did damage assessments for Benzie County. Benzie County was early on in the list just because we were able to access all of our residences where Wexford and Sheboygan were still underwater. So it took a little while to safely be able to access a lot of those residences. The state has compiled all of their data, all of those thresholds. We did the math to all the thresholds we were told we had to meet. We met those, and that has gone to the governor's desk, and the governor has pushed that forward to FEMA and to the office of the president. So now we just wait. If a declaration comes down from the office of the president, anybody who is in that area would be eligible to file claim. Not just the people that I met with and did surveys for at their house. So it just becomes a blanket for Benzie County. A couple of things that I've learned since doing the assessments, we have some damage along the North Shore. That's a clay cliff. For those of you who are not familiar with, especially the Lake Township end of it. And there are 2 different places that have actually sloughed off. They haven't come onto the road to impact infrastructure, but one is very close to a home, a cottage. Those don't fall under any type of FEMA category. You have to have your house has to be impacted, your living, your lifestyle has to be impacted, or your business or public infrastructure has to be impacted. And those didn't do either thing. one, maybe both, may be eligible for small business association type loans. Because if they're cottages and they rent them out, it's probably could fall under that. But it is something that has been put on our radar for like natural hazard mitigation, knowing that the North Shore is gonna keep getting smaller. The hill keeps falling down and the lake keeps cutting in. So there's always gonna be that hazard along the North Shore that I have talked to the road commission. We're just kind of keeping an eye on, but that it will impact infrastructure eventually. And I just put out a post recently, and I just want to say it out loud. There's that the weather, that April weather has done some impacts to some of our recreational areas, especially like the Betsy River. Betsy River is a natural river. We don't go in there and just cut away everything. And there aren't a lot of houses that are nearby. And Benzie County has had at least 2 calls where responders had to respond to the river to assist people. I know there's been other calls where responders haven't gone. They either self-rescued or someone helped them. So those things that were normal, not the same Betsy River anymore, I guess is what I put. They need to watch out for hazards and things like that. And there's no way to get that information out except to repeat it several times. So hopefully into the summer, we can have a safe summer and not have more impacts based on all that weather. But we did have a lot of damage in just spots we can't see. Any questions for me on that FEMA status? Thanks.
Thank you.
Hi, good morning. Greg Hubers, Undersheriff for the Sheriff's Office. We'll start with the jail this morning. The jail currently this morning, we have 35 inmates, 18 Grand Traverse inmates, 17 Benzie County inmates. The numbers have ranged between 35 like it is today, all the way up to 40 in the last couple of weeks. So we're staying real high in the count there, especially from Grand Traverse County. In the jail, as far as hiring, we managed to retain 1 part-timer who left to go do some building project. And we managed to get him back full-time status, which makes us all really happy. He's a very good officer with a whole lot of experience. So we're glad to have him back full-time. We have another interview tomorrow for corrections with a very promising candidate. So promising that hopefully he's not watching this meeting, but we'll probably hit him with a conditional offer tomorrow to try to get him really quick. He's retiring from the military and wants to come work corrections. So we're going to try to grab him before somebody else does. On the roadside, we held interviews for sponsorships to the academy. One of those positions was replacing Suzanne Mall as the now newly rebranded crisis response deputy. And the other is to replace myself down through the progression. So with that being said, I've told the sheriff that I will be retiring in January. The date is yet to be determined by MERS. I did this 6 months out so that the sheriff could find somebody and that I can help train that person so they're up to speed rather than that person have to start from ground zero. So that's the 2 vacancies that we're filling by sponsoring people through the academy. We have given conditional offers to 2 of those 7 we interviewed, and we have a really good candidate pool. Of those 7, frankly, I would have hired any of them at certain times in our history. So I was very happy with that candidate. And before I forget, Dusty, congratulations. Dusty is that voice in the night when I get called at 2 in the morning to come into work that I hear. And I'm just glad to hear that it's Dusty because I know everything's going to be okay and it's controlled. And I tell her that all the time. I'm like, I'm so glad to hear your voice. It's controlled when she calls me, and I appreciate your work, Dusty. Congratulations. All deserved. I think that's everything. Please know that I'm not going to slide very slowly into retirement and try to put my feet up for the next 6 months. I actually described it more as fast, furious, and fiery. There's some goals that I've had for our agency and for myself that I fully intend to meet in the next 6 months. Most of them have to do with policies and upgrading though. So please know I'm not sitting up there with my feet up on my desk waiting for retirement. That's not how I roll, okay? Any questions of me?
You have the right to, I'm sorry.
We'll wait until then.
Okay.
Any other comments or questions? Then, great, couple of things. First, we've had a jail administrator in place now, how long?
Probably 6 months. That's just really a guess.
And how are things working out with that?
Things,
What improvements have we seen in the jail as a result of that move?
the very first improvements are in your packet and they are the jail inspection. We seem to always pass the jail inspection, but the comments on this jail inspection, really were geared toward how well prepared the jail staff was and the jail administrator was for this inspection. With everything in place, so the inspectors didn't need to go find things in different places. It was all there in a 3-ring binder and made really simple for them. If you keep the inspectors happy and they don't have to get up out of their chair, you're gonna win every time. That's the most notable improvement. Lieutenant Simmons and Sergeant Cotton were the ones who probably worked the hardest on that, but everybody contributed under their guidance to make that jail inspection. I think they wanted to prove themselves and they did very well. I couldn't be happier with our choice.
And that freed up some of your time to focus on other things?
It did. And I'm very happy for that.
And I know it's 6.5 months out, but the community's loss that you've decided to retire.
Well, thanks. I appreciate that.
Any other comments or questions? All right, thanks for being here.
Thank
Greg.
you.
Other department heads or elected officials? If not, we'll close that out and go to approval of the bills. Who did the APs?
Gary covered for me.
Right.
I
Okay,
did them, yeah.
Good.
So you want me to make the motion, I will.
I can't instruct you to do that, but if you
Well,
want to, feel
I'd be
free.
happy to make that motion.
I'm learning, Rhonda. Did you want to make a
I just did, yeah.
is there any support?
Pay the bills. You can't find it.
I'll support.
Thank you, Bob. Any comments or questions?
164,883.63.
Did you get that?
Yeah.
Amy, okay. All right, let's do roll call, please.
Markey,
Yes.
Matthews,
You
You
need
had
to
to
step
step
out.
out.
Nye,
Yes.
Roloffs.
Yes.
Sauer,
Yes.
Janat,
Yes.
motion carried.
All right, we'll move into presentations and Christy, really glad that you're here today. Peter, it's been a while. I know that we've done this now 2 or 3 years in a row, and quite frankly, we value what the hospital brings to this community, both economically and from a medical perspective, so we look forward to hearing your presentation.
Need to drive or do you want to drive?
It's just
It doesn't matter, you can, fine. So first of all, thank you very much for having us. We're very happy to be here to share information. We're gonna do pretty high level here, so we have time for questions if anybody has questions. Because my guess is you probably do. I do want to share that this is our 75th year. So we've been over on the Hill there for 75 years now. And before I get started, I do want to introduce myself. I am Christy Johnson. I am the South Region Chief Nursing Officer, and South Region is comprised of Frankfurt, Manistee, and Cadillac hospitals. With me, I have Peter Marinoff, who is the CEO and President of the same South. So we are here to answer questions, give you information today.
Oh, geez, that's quick.
It goes pretty fast. Right. So here, so over the last, I don't know, since COVID, probably, we have had many, many changes, not just in Paul Oliver or the South Region, but over the system. But what you are seeing here is what I consider to be a really strong, very sharp leadership team. And this is your current South Region leadership team with Peter leading us all. And then Kristen Brandsma is the Chief Operating Officer, myself as the Chief Nurse, And then Dr. McComb is the Chief Medical Officer. And we have a really unique structure in that the four of us go to all of 3 hospitals and really manage the work in all of those hospitals. It has been a good, and then we have support of all the others here as well. It's been a really good structure, and we've been able to affect a lot of really positive changes. So, fine. All right, I'm gonna pass over to you.
Thanks, Christy. And again, Peter Marinoff, I've actually been with Paul Oliver for 25 years in a different capacity over those years. And it's really cool to be here today to talk about a system perspective on these things, because I was the president of the hospital up through COVID and then was transferred over to Cadillac and back again in the regional role. So just really quick, Munson Healthcare, I wouldn't call us one of the largest systems from a finance perspective or employees, but we are quite a large system in that we cover, so you can see they compare it to the size of Delaware and Vermont combined, but we actually have 1/3 of the counties in the state of Michigan really depend on Munson Healthcare to deliver healthcare to them. So we are a rural system, 7,500 employees, probably getting closer to 8,000. We do have 8 hospitals involved, 142,000, probably more approaching about 150,000 ED visits. Surgeries, about 33,000, 40,000 inpatient visits. It's a large system from geography, but it's small. So later on in this presentation, we'll actually talk a little bit about how have we restructured ourselves to better deliver high quality care to our rural areas, because when you look on the map up there, we are really spread out around northern Michigan. So we had to reposition ourselves to better handle that. So you can see it's defined by South, Central, and East. We'll get into that more later on in the presentation. And back over to Christy to talk about Paul Oliver.
And for those who don't know, I hate to even say that I've spent 38 years with Munson. The first majority of it was up at the medical center, but I've been at Paul Oliver already for 8 years. So, and I have to tell you that this is a gem. This hospital does an amazing job. They provide a ton of services to our community members, and the staff that are there are just committed to making sure that they are doing the right things for the patient all the time. So what you see is that we have about 200 employees. Our emergency department sees about 6,000 patients per year. The other thing that I want to highlight is that we have had the Guardian of Excellence Award in our emergency departments 4 years running. And this is and we'll talk a little bit more, it's a national award. Our long-term care has been nationally recognized as a top performer. And we're, and getting ready to celebrate our 75th anniversary this year. So we're going to have a community event. We hope some of you will join us for. That Guardian of Excellence Award is awarded to the top 5% in the nation. This was out of 41,000 healthcare facilities. And Paul Oliver's emergency department has won that award or received that award the 2022 through 2025. So, and that really means that for patient experience, we are achieving a 95th percentile or better in patient experience. So they're doing a fantastic job there. In addition to that, our Frankfurt Medical Groups and our primary care groups, so Frankfurt Medical Group and Empire Family Care, have also achieved that award 2 years in a row. So it's not just our emergency department. This is, we expect quality and patient experience to be very high throughout our facility. Here you're seeing our primary care providers, and both of our primary cares are fully staffed now. They are accepting patients, and they do a phenomenal job. So our newest addition was Dr. Beth Moore, and she does specialize in women's health. Nursing home, our nursing home and skilled rehabilitation center, again, was named by, gosh, I'm going to get this wrong. U.S. News and World Report is for 5 out of 5 for long-term care and 3 out of 3 for short-term rehab. And this is related to value, cost, keeping costs down, delivering personalized care, and then outcomes. So making sure that what they came in for, they were treated for, and they go home and are successful at home. So All right, Claire, back to you.
Yeah, thanks. And before I talk a little more about the system, I do want to point out, so my mentor, Jim Austin, who was the president of Paul Oliver before I got into the role, he actually applied for Paul Oliver and we were the first critical access hospital in the state of Michigan. So I think that's interesting history. And doubling down, our actual 75th birthday this year falls on National Rural Healthcare Day in the fall. So it's really kind of cool doubling down. So, and we're gonna have a little party on that actual day, but we've got all these other celebrations planned. So I just want to note that for everybody. It's pretty cool. So our values, I'm going to just touch on that really quick. The excellence, teamness, positivity, exceptional experiences, creativity. What we've done actually over the last 3 or 4 years is we redid our values to try to modernize and kind of understand what is it that the communities value the most, and then how can we reflect that through our values. So Munson had really worked on those values, had those same values for 30 plus years, as long as Christy has been here. No, I'm just playing. So we had those values for quite a long time, but we needed to really kind of change ourselves with our communities. So as part of our regional structure change, we updated our values there. Our purpose, quite simply, is we improve lives. And I'll kind of go past the mission there and get to the vision. And I think the vision is key, because there's a lot of change that happens around us all the time. And while we change, the one thing that will always be the same is you can depend on Munson Healthcare. And so we want to be that trusted source for compassionate, seamless care for another 100 years. So that really originates with Traverse City and Dr. Munson being involved there, but then spreading out to the surrounding communities. And if you think about, Dr. Paul Oliver and our hospital being named after him, 75 years, it's pretty special. So we want to be around for another 100, even though we haven't been here for 100 yet. We're working on that. Yeah, with AI generated Christy in the hospital. Next slide, please. So regional care transformation plan, and this is where some of the questions may come up, but it really is I'm going to call it more than a 3-year plan. And it's to create what we would call greater access, the consistent quality experience. I think regardless of what we're doing, that is always central to Munson Healthcare and what we do. It's got to be consistent and the quality has to be high. But the access is something we really had to work on. And it was a recognition, I think it's almost 4 years ago, that maybe 5, we had to start changing, because you could see forces within healthcare that were going to require us, especially in a rural environment, to really deliver care differently and to change our approach. For Paul Oliver, it's not been that big of a change, but for Manistee and Cadillac, it was quite profound. And the reason why we had to make that change is we would have less access to physicians coming out of school. There's less physicians graduating. There's less healthcare teams or staff coming out of college, and there's a lot of retirements happening. So we had to redefine how we were deliver care so we could continue to keep that quality experience around. And if you take a look at what we've done, the patients actually that come to Paul Oliver, they actually have more options. And so by going with a regional care plan, when patients are in our ER, we can give them options. It used to just be, oh, Christy, you showed up to the ER, you need higher level of care, you go right to Munson Medical Center. Our patients, actually, our community members, they can go to Manistee, they can go to Cadillac, or they can go to Traverse City. You can go outside the system. I recommend it to I have just my bias there, stick with Munson. But we're offering people other alternatives. And if you think about when you go to Traverse City's a city. Like it's a bigger place. There's a lot more going on. It's a 450 bed hospital, roughly. And that experience for people coming from our rural communities, they may not need that size hospital. They don't need all those specialties for an inpatient stay. So you could go right to the south to a Manistee hospital, which has under 40 beds. So Manistee can deliver that high quality care. They can actually be 30 minutes from our community. They don't have to drive through the traffic to get there. And it's very simple. If they need a higher level of care that requires some more specialists, they can go to Cadillac. I will tell you, Cadillac's an hour away, but Cadillac's actually a top 20, top 100 small rural hospital in the country. Our specialties do a great job. I could tell you about some community members, I'll keep them nameless, that have actually come to Cadillac and they've enjoyed the stay there and kind of surprised at what we had to offer in that community. So from a perspective of Paul Oliver, the regional care, we really didn't change a lot within Paul Oliver or what we're delivering here at Paul Oliver. It's the things around it, and it's how we were able to enhance things for our community members and how they could get care after Paul Oliver. Next slide, please. The one new addition, I don't know the scale of the impact for the Frankfurt community, because I think that's something that I get from a question perspective. And it's the surgery center that we're opening. So we actually will do our first cases next week at the surgery center. It really just offers community members in and around what we would call a more value-based approach to their care. So rather than getting care in a hospital or surgery or for a scope or eye surgery, it's a little more expensive to do that in a hospital. When you have an outpatient surgery center like this, you can actually access care at a cheaper rate. There's different contract structures that are in place for those, and you can get that same quality. So for us in the surgery center, our medical executive committee is comprised of surgeons from Cadillac Hospital. So Cadillac is a 5-star hospital, Leapfrog A scores, just very high quality in that hospital. Those same surgeons will actually be practicing in that surgery center. We'll continue to work with interests that we're getting from Traverse City or Manistee for surgeons that want to come down and perform surgeries there. But I can assure you that the quality will be just as high as what you would find in any of the other hospitals. The visit's a little faster. And if you're interested in visiting, I'd love to host all of you. So that's kind of the surgery center. The interesting piece, and this may come from the questions afterwards, is that a lot of the regional care transformation that we've done over the years, it's actually helped us to rebalance our costs around, I'll just say the southern region. And so a lot of the changes that we're seeing as far as Medicaid, qualifying for Medicaid, payers, government changes, regulation, a lot of the redesign we've done almost has better positioned us to transition into kind of a newer stage now with how we're getting reimbursed. So I'm excited that we were able to predict something maybe for once. It feels like you can never predict anything, but it feels like we were ahead of a lot of the changes that we're seeing now. And I think you read a lot of articles about hospitals that face closure. I think there's 800 some in the country that are in danger of closing. I'm happy to report to you today that none of those hospitals could be found in the South region, and we're proud of that. So I just wanted to share that with all of you. Next slide, please. All right, back to Christy here.
This is an easy one. I'm not going to read all of this, but so Paula Oliver, the main campus is full service. The hospital. We have 8 licensed beds. We have a full service emergency department. Our long-term skilled rehab is on the 2nd floor of that building. But in addition to that, we have cardiac rehab, pulmonary rehab. We have full PT, OT, speech, wound care. So there's lots of services that are all listed there. But in addition to what you're seeing here, we also have 5 offsites. And I like to say, I don't like to say, because I wish it wasn't true, that Paul Oliver is sometimes Benzie County's best kept secret, because people don't really know what's there. But we truly do have most services right over at Paul Oliver. Can you go to the next slide, please? Our off-campus sites, you're seeing 3 of them here, are, let's see, Hosick Health and Fitness Center. Again, the Journey program, Active Steps programs are there. Those are free to people. And they just have to come in, ask about the programs, and our folks will get people signed up for those. And that's a cancer rehabilitation or diabetes support group. The Frankfurt Specialty Clinics, of course, and our Empower Family Care. Those are our primary care practices, taking patients. Empire also has a laboratory, and we have Mary Free Bed at Munson. So our physical therapy is there as well. And then we have outpatient services at Benzonia, which also is laboratory and physical therapy. We have a aquatic therapy pool there. So we do have pool therapy there. And then Interlaken, we have radiology lab and therapy there as well. So, and with that, I think we're done. So I'm going to ask if anyone has any questions for us.
Harry?
More of a statement than a question. I just want to thank you for letting us use Dr. Kuiper for the health department. We appreciate that. Whenever he does have problems once in a while making it, but it's a great asset to our health department. And I want to thank you for allowing.
Absolutely. He's
to do
a
so.
great physician and cares a lot about the community. So he's invested.
I think it's great that you come and speak on this. It lets our community know what you're doing, and Paul Oliver's been there for a long time, and the changes, the pivot that you're making is important for the community to know. Do you experience any problems? You employ a lot of people with the housing and childcare issues that our community experiences?
We really do. You know, unfortunately, we see a lot of turnover in some positions. So childcare in those positions is a big deal. And then for our professional positions, we've actually had people that have accepted offers but can't find housing. So then they, you know, don't end up coming to us. And Peter, is there anything else you want to say on that?
And it's kind of a universal thing. So in Manistee, we actually had a position that was open for almost 1.5 years for a sonographer. And we hired her on, and she almost couldn't find housing. She spent months, and through the support of the chamber, we were able to help find some housing for her. But it took some working through some issues to get her in. But that is something that I think Traverse City seems to be the highlight on things a lot of times. We're just as vulnerable in our communities around here.
Sure.
Like some of our therapy professionals, open position, struggle to find them housing. Oh, and they want a home. They'll rent for a little while, but they're not gonna come and build their life here if they can't.
Sure.
So.
Other questions or comments? Tim?
I have a couple for you
Can I
guys.
stop you just for a second? Christy, we have people online joining us. So when you speak, would you step up to the microphone?
Just recently, Benzie County did vacate some property that the hospital had. Do you guys have plans for that?
Probably, yeah. So we always look at a master site facility or master site plan that we have. So we don't have anything exactly mapped out for what we will do there. Our concern with the hospital right now is that we've been reclaiming areas within the hospital, and we're kind of at our point where we might need to think outside the hospital. So we would probably evaluate the sites across the street for possible medical office space, but we haven't started the process yet.
Okay, my next question is around transports. Your emergency room being the level it is, I do know our EMS frequently does transports from Paul Oliver to other locations, which it then takes that ambulance out of service for people that call 911. Any ideas or whatever to help mitigate using Benzie EMS or any EMS for that matter?
So I guess we haven't really, we do use MMR. So we actually use them a fair amount, not, I wouldn't say a lot, but a fair amount. So when we know that Benzie is tied up or not available.
What I guess I was getting at is there an opportunity for Munson to have their own to transport these patients.
Yeah, I'm not sure that that's a route that Munson is wanting to go down again, but certainly it's,
Oh, no, that just, I
Yeah.
was just curious.
yeah. I mean, we, at one point, we did have that. So, but certainly always open to conversation.
Yeah, oh, thank you.
And then the only other thing that I want to add is Katie did, ask if there were any opportunities for partnerships. We are always open to that. Want to be important to the community, and we want to invested in part of what's going on. So please let us know.
I asked one real quick question. She said that. The Aquatic Center, have they reached out to you that they want to build up here? And I can see that as an asset to folks too, so.
Yep. So we've been in contact with them and
okay.
talking to them.
Good.
Yes.
Excellent.
Yep.
Thank you.
Right. Have a good day, guys.
Christie, before, I'm gonna, couple of quick hits. Some things you can answer and some you can't, right? But, Peter, when you talked about space needs, the growth of our community, commissioners are dealing with the same thing within this building. What can we reclaim? Trying to anticipate what do the next 20 years look like? Because if you give it up now, there's no going back to it, right? Housing is a high priority for this county. We don't want government to own housing, but we want to be part of the solution. We're working towards that. Unfortunately, it's happening one unit at a time rather than, something that would happen more quickly. The nursing care that you provide, how does that work with the Maples? What's the relationship with that? Any opportunities there that we should be discussing with the Maples board?
So, we don't have what I would say like a daily conversation with the Maples, but we do send patients back and forth. So we do work with the Maples quite consistently. I would say probably our skilled rehab volume is probably higher than their skilled rehab volume. They probably do more long-term. So a lot of our patients will end up there later. There's always opportunities for better collaboration and working together more. I don't want to, like, we don't compete that I'm aware of for patients, but we do send patients back and forth.
Well, we're at about 100% occupancy there, so we don't need to worry about
Yeah.
competing at this point. Different direction. There's been a lot of press in the last 12 plus months about government appropriation towards rural hospitals. How does that affect Paul Oliver
I'm gonna let you take that one.
or Munson system?
Yeah, so are you talking about like the rural health fund
Yeah.
that they're talking about? So the cuts probably I mean, I'll keep it more to the Munson system. The rural health fund is not a guaranteed amount of money that comes in, and it actually comes to the state and then gets distributed amongst various players within rural healthcare. I think our anticipated cuts from government funding, if we said it was $100 of cuts, the rural health fund probably gives us $20 back, maybe. So the appropriations, the intent of the appropriations coming back to the rural health fund is meant to help us re-engineer and build for the future and to change. And I think it's meant to change the face a little bit of reimbursement into healthcare. So rather than having healthcare dependent on a system of like fee for service, the intent was for us to then kind of take this money, retool, modernize on infrastructure within the hospitals. The tough part is there are still people that will seek care that will go unfunded in the hospitals. So that's where the burden will come a little bit on the hospitals and where we have to figure out. So the appropriations we're getting, while welcome, they're not enough to cover what we're losing. Does that answer that, Aaron?
Sure.
Okay.
I get it. Probably as well as you can answer it. Yes.
It's kind of complex.
There's a lot of pressure in your industry for merger because of the investment in technology. How does that, and I know that Munson over the years has had discussions with other operations. Can you speak to where that's at now and what those partnerships or mergers might look like? How would it affect us, et cetera?
That's another kind of gray area, to be perfectly honest, is that we actually have a lot of relationships existing. So Trinity, which is a large healthcare system across the country, we partner with them actually on purchasing. Corewell, we do a lot of partnerships with them, especially in the peds area. Michigan, we partner a lot on cancer care, and neurology with Michigan. So we have a lot of existing partnerships around. I think what we're seeing probably in healthcare is rather than doing straight merger and acquisitions, the tendency is to actually do what you would call a closer relationship with the system, where you're using synergies to partner on things like IT or physician programming that can stretch across. And really the purpose of that is the IT costs, especially in cyber. How long could we spend talking about cybersecurity? And those costs have just absolutely ballooned. And the physician market and some of the specialties has absolutely bottomed out. So these tighter relationships get you greater access to resources, and then you can strategically align with it. So for Munson, we currently enjoy some of these existing relationships already, but you could probably see in the future kind of trying to evolve maybe more formal partnerships. And that's just an industry trend now. So it's not necessarily a merger, but it is more of a what you would call a formal working partnership, just on paper.
From a community standpoint, I like that approach better because it keeps influence and decisions more local.
Correct.
You know, the more regional you get, the further away from your patient base, the community that you're in. They're not bad decisions, but they're different decisions that might otherwise be made.
Yeah, I mean, there's a lot more politics in it
Yeah.
when you're at that bigger scale.
And this is, I say this for the benefit of the public, when Gary had talked about how you lend to the community beyond your medical assistance. For those of you that don't know it, Peter for years served on the Benzie County Chamber Board. And I know that took away from your duties, but we appreciate the fact you did that.
Thank you.
And Christy currently serves on the new reinvented chamber, which we have quite a working relationship with as a county. So that's a commitment that we appreciate you guys being involved in.
No,
Yep.
thanks.
That's all I've got.
Thank you.
Sorry to keep you standing up there. I keep thinking about the housing issue, right? And this might be just a Traverse City thing, but when I go to the VA hospital there in town, most of the doctors and specialists, nurse practitioners that I deal with live in Kalkaska County, for example. A lot cheaper. Traverse City, you gotta be kidding me. Trying to find a house there. But I'm wondering if that's built in. I know it's an hour and 20 minutes from Kalkaska to Paul Oliver, so that's probably not realistic, but has there been some research done out there saying, okay, well, we can't quite get you close to the facility, but 40 minutes is not ridiculous. Maybe in the wintertime it is, just to kind of bring these people in and give them options at least. Can't get your house here, but I can get your house over here.
Yeah, no, go for it.
So I think that's exactly what we are doing.
Okay.
So, most often they're finding housing further out than they would like, but they're finding some housing.
Right.
It's just tough. So for them, but
Yeah.
yes, you're 100% right. That's what we're doing.
It's gotta be
We
difficult.
have a lot of people that are traveling from Kalkaska to Cadillac to,
Right.
so they're traveling all over the place.
Okay. And the Kalkaska Hospital, that's a Munson facility now, isn't it?
It's affiliated.
Affiliate.
I don't-
Okay. All right.
Yep.
So I'm curious how that worked. All right. Thank you.
Anything else? Thanks for taking the time to be here today.
Thanks so much for having us.
All
Good to
right.
see all of y'all.
Good. Dan?
Okay, good morning. Dan Thorell, the health officer for Benzie Lynn District Health Department, just here to touch base about, well, really our 2025 annual report and just give you some updates, answer questions. Really 2025 was a pretty challenging year for us. We had some pretty significant cuts, about $700,000 about midway through the year. We were notified on March 31st that these cuts would go into effect the next day, which was pretty tough. And to make it even more tough, we had a new finance director who was on the job for approximately 30 days. So it was kind of those, one of those moments that, keep you up at night, so to speak. So, but I will say, I'm so proud of our staff for adapting and overcoming and just coming together and really trying to figure it out. We spent a lot of time looking over the budgets, from that time all the way through our budget that we put together for fiscal year 26. So I'm really proud of them, and I just, I think we really weathered the storm well, and I'm really proud of our staff for stepping up because we did have to basically not fill positions. We were lucky that some of the positions that were lost due to attrition. People were retiring. We didn't refill them, and we ended up having to lay off one person going into the fall. But I think that was pretty, it could have been a lot worse, so to speak. So, and the existing staff that are there have really stepped up and just really, adapted and just done things that we've asked them to do. And I just really appreciate their hard work. And also even in the community, some of our affected schools, because one of those programs was a school nursing program, and some of the affected schools said, hey, we don't want this to go away. We want to contribute to keep this going. So we had our schools, partnering with us, contracting with us to keep some of these staff in place. So, which was great. And as you remember, on top of all that, we had the state budget going into this year was not passed until like the first week of October. So, anyways, that was kind of the cherry on top. But, yeah, despite all those issues, we had a personal health director, Michelle Klein, that won a statewide recognition through the Michigan Public Health Association as a nursing leader. We had several staff that gained professional degrees and a bachelor's degree and master's degrees. And at the Benzie Community Resource Center, we also renovated our environmental health space using a public health infrastructure grant that was specifically set up for that. And that project went smoothly. It improved our space greatly, not only for our own efficiencies, but really for the public, just a more inviting space for the public to come in and do their business. And we also brought on some new software for environmental health, which is utilizing GIS mapping, which right now is kind of the ground floor. We're building on that. And, going into the future, 5, 10, 20 years down the road, we're basically building this world map of septic systems that are installed, wells that are installed that will be living on this map. So future sanitarians will be, as this is being built over year after year, go in and they can see all these things in real time on this map. And it's really improves the efficiency for permitting and whatnot. So it's really it was a huge upgrade for us. So, I just want to touch on a few things that are highlights that are, kind of out there. You may have questions on them yourself. Immunizations in Benzie for 19 to 35-month-old children. We're at about a 68.6% coverage for recommended vaccines, which are anything from DTaP, which is tetanus, and polio, MMR, which is measles, mumps, rubella, pneumococcal, varicella, which is chickenpox. That's kind of that list of recommended vaccines. The state average is about 6.7%, and the US average is 96.9%. So we are, falling behind. And if you look at kind of the trend line of what has happened over the past 10 years, we've approximately had about a 10% decrease, in that rate. Since COVID, about 8%. So since 2020, basically the 8% of that 10% is in that time frame. And really it has a lot to do with just trust, right? I think through that time period, I don't have to rehash it. We all know that, there was some lack of trust in the government and public health, in general. So we've been doing a lot of work to try to rebuild that trust and just, having honest conversations and trying to help people, understand the risk and benefits of vaccinations and whatnot. And we've actually started a program for school-age children because they can opt out of getting the recommended required vaccines. They can opt out, but they do have to get a waiver, excuse me. So that process has been simplified and more consistent as far as the messaging through an online kind of hybrid process where they go through some online education and then come in to get their waiver signed. So through that, it kind of takes out where before you would have a public health nurse doing that work. And if you had a brand new public health nurse, that could be challenging, right? Because it is very complicated. There's a lot of information versus someone that's been doing it for 20 years. So this is delivering a very consistent message to the public and kind of makes it, I don't want to say easier. It's not intended to be easier. And that was kind of one of my concerns at the beginning. But I think it's more about just giving the right information and then having those conversations, right? That's the important part. I will say, our MMR, measles, mumps, rubella, that is something that is a concern. And it's, our rates are better in the older kids, the 13 to 17-year-olds. We're more up in the 86.4% range, but though measles is something that's been popping up around the country in different pockets. And that is something I'm worried about. I think you see on the news, people talking about Ebola and worried about the World Cup. I don't really worry about Ebola. That's very tightly monitored, and it's very much in Africa right now. But what I do worry about is measles, right? Because there's going to be people coming from all over the world that, have various rates of disease. And that's something that we need to watch, So jumping into kind of our maternal infant health program, clients have really been increasing if you look at our trend lines in our report. And that includes also Healthy Futures. And that's really helping the young families, young mothers, young children. And then our WIC clients have held steady for the past few years after a sharp decrease in 2023. And I really wanted to try to understand what was happening there. And between the two counties in our health department, 70% of the WIC clients are Benzie County. Okay. And a lot of this is anecdotal, but I know, we talked about housing. You were talking to the Munson folks about housing, and that is something that we definitely see in our clients, right? They have trouble getting housing, so they may be moving out of the area, being displaced by short-term rentals or just lack of affordable apartments, so to speak. So, because in 2019, we had 1,300 clients and we, basically are running about almost half of that now, which is, a pretty significant decrease. And I think is maybe a barometer of what's really going on as far as the young folks in our community. So, just jumping into some EH trends, environmental health trends, licensed food establishments. We have 129 of those in Benzie County, and food trucks. We have 26 that are licensed. That has been pretty consistent over the past few years. Our food safety inspections, have risen along with that. And that's really just, due to the efforts and work of our staff in that program. Land use, our time of transfer evaluations are trending upwards. That's been a very robust program. We've seen an increase of about 22% from 2023 to 2025, which is pretty significant. I mean, there's a lot of activity in the real estate world, a lot of properties being transferred, and that reflects that. That number reflects that. Septic permits in Benzie have risen about 19% in the last couple of years, and that is pretty significant as well. And we really had in 2021 probably the the highest year that we have ever had as far as permits, but I believe we surpassed that in 2025. So a lot of activity in that area. Same thing with well permits, kind of tracking with that. Looking at our financials, after all the financial challenges in the spring in 2025, again, I just have to give a shout out to our leadership and staff for really adapting and overcoming the situation. We ended the year, which, I would never would have guessed that, but this is through a lot of those actions that we took early on, adding to the fund balance of about 140,000. And that's some of those moves we had to make with staffing, but another part of that was in that renovation project. We had really built in a pretty robust contingency fund because we're tearing into an old building that we had, maybe not the best plan. So we didn't know what we were going to run into. Fortunately, that we didn't run into anything significant as far as having to deal with any structural issues or anything. So that left some money on the table, which was good. So we came in. How often do you hear that a construction project came in under budget, right? I mean, that's a pretty rare event. So I'm happy to say that was the case. Of course, we appreciate your continued support, financial support through local appropriations. And even though our local appropriations amount of our total budget is small, so at 7.2%, it's very flexible. Most of our funding is very grant dependent and very siloed, and we can't really shift it around to where we need it. So the local dollars are flexible in that way and really help us tremendously. And they can also be used for Medicaid match, which is almost a 2-to-1 return. So it's a good deal for our local area. Overall, our fund balance is healthy. We're sitting at anywhere between at any given time between 15 and 20%, kind of more in between there, 17 or 18. And I'm told by our auditors and accountant that that's a healthy place to be. So anything above 15%. With that, I will just give you a couple of really quick updates about what is going on, looking ahead into the future. As the Paul Oliver Munson folks were talking about, rural health transformation funding. Okay, hospitals are really not getting a big piece of that. It's more going out to the rural healthcare partners, and health departments are no different. I'm actually the chair of the Northern Michigan Public Health Alliance, and we're the 31 counties of the northern lower, so knuckles up basically, and the 7 health departments in that area, we operate together on a couple of projects. My Thrive, which is our community health needs assessment, shared with the health systems in the region. And then also Community Connections, which is our program where we have community health workers taking in referrals, a lot of referrals from Munson, as a matter of fact, and other healthcare systems to help people address their healthcare barriers. Okay, whether that's transportation, food, can't pay their bills, those are all big factors in determining someone's health or things that they have to deal with because it causes stress. If you don't have reliable transportation to get to doctor's appointments, that's huge. Or just economic insecurity, like housing is another huge issue for people that need to seek healthcare. So we are getting some rural health transformation funding to help in that program, which is really good because we were kind of operating on a shoestring budget. Okay. And we were really concerned about this year going forward. And I will say a lot of this work is really concentrating on chronic disease like diabetes and hypertension, high blood pressure. And that is something that, public health has not traditionally been involved with. And I think it's about time that we are, because our populations are aging in Northern Michigan, Northwest Michigan for sure. And, that trajectory, we need to address some of those issues, from a public health standpoint. And those programs using community health workers are going to connect folks with those chronic disease issues and help them navigate the system and connect them with healthcare. Okay. And that's the big picture there. And also working through the data part of that and referrals between the healthcare systems and our community health workers too. Community Information Exchange, it's called. So basically our software program where we collect the data and have our outcomes inputted into that will ideally talk with, let's say Munson, they have Cerner, which is their EMR, electronic medical record system, and be able to basically send data back and forth regarding that and improve that piece of it. Because right now it's very clunky. And so there's funding that is identified for doing some of that. I will say there's other, as we go down the road, because this funding is slated to go through about 5 years, we're seeing other opportunities come up. I just basically was made aware yesterday of an opportunity for workforce retention and recruitment dollars that would go right to Benzie Leelanau District Health Department. It's not a lot of money, but it's something I think could really help. You know, again, as you brought up and talked about like housing and things of that issue, we do have a personal health director, Michelle Klein, who is retiring in December. And that's something that's on my mind as far as recruitment. I think we will have some good internal applicants, but if, you know, we don't, we just never know, right? What people are thinking. We also are going to be posting that position to the outside. And what does that mean for somebody coming into this community, right? If they were coming from somewhere else. So, and I know that's on a lot of department heads' minds when they're recruiting for staff. So, that's about all I have as far as updates. I have a lot of other stuff swimming around in my head. So if you have any questions, I would be happy to answer them.
Let's do that. Let's open it up to questions now or comments. Gary, you've served on the health department board for a while. Anything you want to add?
Dan was successful. I was gonna let this pass. At getting Grand Traverse County to contribute to the Community Connections program. I got him to do it for 1 year.
1 year. Yeah.
And, you know, the function before was actually done by Munson, correct? Or am I wrong? And DHS.
Of Community Connections.
And then it kind of got,
Well, I guess I don't know the answer to that. I just know from 2016 to now, you know, basically a decade we've been doing that program. And before it was well funded through Department of Health and Human Services. It was part of that state innovation model for healthcare that Governor Snyder started, and there was significant amount of investment, let's say, into those programs. And up until about 2023, it was well funded and very successful. I mean, there's a ton of data that is collected. If you go to our Community Connections website, I mean, you can see all the data from every year about all the referrals and how many people were helped, and you know, and it's all organized into different pathways, whether it's food, housing, mental health, transportation, and it's really interesting data. And I would encourage you to look at it sometime. And I know we talked about maybe having at a different time, not now, but having our Community Connections folks come in and do a presentation just to update the board on, you know, what's going on there. But a lot of things changed a couple of years ago when CMS Medicaid required the hospitals to refer people that were experiencing those type of needs. And so our numbers shot up like crazy. And, you know, we quite honestly struggled to keep up with it. So, and have continued to struggle to keep up with it. We have contracts with Medicaid health plans, but they don't pay what they should. They don't pay enough to really do to cover the costs. So, Grand Traverse, it's, you know, at Benzie Leelanau District Health Department, we, as part of that, have Grand Traverse County and Community Connections. And that was something from, you know, day one when I started here in 2022, got me scratching my head. And I'm like, we need to spin that off back to Grand Traverse County Health Department. The reason, I won't get into the reasoning why that is the way it is. We've operated it well, but one of my challenges, we cannot use local dollars, obviously, in Grand Traverse County. We don't want to, we're not going to, it's not even legal. And it's not something that's even right. So like that like Gary mentioned, you know, I went to Grand Traverse and I said, we're going to stop doing this in Grand Traverse County unless you give us money, right? Unless you give us money. And they gave us $100,000. So that was very helpful. And for this year going forward, we were looking at different avenues. One of them was through their opioid funding of potentially, you know, getting some dollars going into Grand Traverse. My plan for now that we have rural health transformation funding, which is kind of popping up and helping sustain community connections, is we're getting the funding. But my plan is to contract with Grand Traverse County to have them hire that staff person and kind of start that process of letting them dip their feet into the water and transferring that work to them. So that's kind of the first step.
Gonna have them do it through their health department or? what?
Yes.
Boys.
No, the idea would be, I mean, so we couldn't really address the way that the money was coming in right now. So what we're going to do is contract with Grand Traverse County Health Department and have them hire their own community health worker.
Good, I like.
Yeah. I knew you would, Gary.
Glenn, you sit on the board?
Yep, I was ready for the question. Maybe it's a softball, maybe it's not. You spoke earlier about infant vaccination rates
Mhm.
and establishing this trust factor with these guardians of these children. What efforts have we launched to bring those numbers up, specifically in that 19-month or whatever you said, 37 or whatever it was, that age group? You said the older ones are a lot higher rate, but focusing just on that infant group.
Right. Well, it's a good question. And it's been a challenging one since we are now at lower staff numbers that we were, right? So our actual number of vaccination clinics has decreased because of that, because we're down nursing staff and public health tech staff. So it is a challenging aspect. And I will say, our personal health staff have really, we integrate like our staff members. They wear several different hats. They work in the Women, Infant, Children program. They work in the MIHA maternal infant health program, home visiting nurses, basically. And so when we do clinics, they try to kind of do a one-stop shop where the folks come in and try to get them into those immunizations that are recommended, okay, at that time. And just trying to be more strategic now that we have school wellness program staff. We have nurses in Benzie Central Schools, for instance.
Right.
And also in Frankfurt schools and really pushing out the health education regarding that and just being available to answer questions. And listen, I don't blame like parents of young children. I don't blame them for questioning. I mean, there is so much information that is coming from so many different directions. How do you know what is true and what is not, And all they care about is they want to keep their kids safe, right? They want to keep them healthy. And if they have, obviously we'd have a lot of questions with all the information that is out there. So our job is to basically just have that conversation, meet them where they're at, be respectful of, if they, are saying that they don't want to get certain vaccines, but they will get the other ones. Hey, that's a start, right? And we are seeing that because in a lot of the time it follows what's going on in the media. You see a lot of information about these measles outbreaks. Now we have families that, we're not getting vaccines, any of the recommended vaccines, but then they decided to get the measles MMR because they're seeing this stuff and they're reading about it. And which I think is, that's good progress, right?
Yep.
I always say going back, I mean, looking at just in general, why is this like this? Why is this happening? I mean, we have all that information that's just that's coming at people from all different directions. But the other thing is, it's generational memory, right? There's not too many, our grandparents and whatnot that are alive that can tell you the stories, right? About losing friends to polio or having huge measles outbreaks and, some of their friends dying or whatever. And I would say, if you really want to know, go walk through one of your local cemeteries and see how many kids are buried there from the early part of the 20th century and what kind of impacts, vaccination, immunizations has had because we don't remember that, unless you've studied it, you don't necessarily remember that. So
Thank
I'll get off my soapbox.
Thanks.
Other questions or comments? If we could, just quickly, any updates regarding the state septic codes?
I knew somebody was going to ask that. So,
That's right.
So there's been several different versions. It's really the same bill that was out a few years ago, and it focuses on a statewide code, which would be uniform regulations throughout the state instead of the individual health department sanitary codes, which is the way it is now, and evaluations. Okay, so we are a gold standard in the state. A lot of the stuff I was brought into the work groups because of that, because of our experience with doing time of transfer, especially in Benzie County since 1992. There's been a lot of back and forth. It's very complex. They just put the latest version of the bill through committee in the Senate, Natural Resources Committee last week. Okay. And so it's introduced, it's in there. It has not been introduced in the House. It depends on who you talk to, whether it's going to get anywhere or not. And it's hard to say because in this lame duck session, anything can happen, as you know, right? A lot of the evaluation part of it is based on triggers, like whether we've ever been there or not, like it's never had a permit, and whether it's within 500 feet of water, or if it's over a certain age. The system is over, I believe it's gone back and forth, but I believe it was 30 and they reduced it down to 20. Anyways, for what that would mean for us is I calculated conservatively, I think it would basically require us, because we have to get all those risk-based systems done in the first 10 years. I figured conservatively, now don't quote me on this, but about 10,000 systems, septic systems. We currently do between Benzie and Leelanau County about 700 evaluations a year. This would add 1,000 on top of that. So for me, looking at it and talking with Eric Johnston, our EH director, the only way that we could really do that is to have private evaluators do the evaluations, and just basically we would run the program or oversee the program. And we would have to deal with the things that come up with they find issues as far as getting those addressed. But I don't see really any other way to do it because we would have to double our staff, and we don't even have the room for that. So does that answer your question?
Yeah.
Probably a little bit more than you wanted to know, but.
Well, I sit on a statewide legislative committee. We were just talking about this on Friday. And what I've learned is, you're right, the bills continue to pass through, but they specifically called out Benzie County and said, we probably are going to be the standard that they follow. So the point of sale is what they're looking at, but it's yet to be seen.
Right.
Yeah.
And at first point of sale, which is what we have, was taken out, saying you couldn't have point of sale, and then it was put back in.
Right.
And then it said you couldn't condition the sale of a piece of property, like say it's not going to go through unless you address these things with the septic system. And now that's been taken out. So now we're back to, it's just a point of sale program, and you can address problems, which is the way it should be. But it's only, so it's allowing communities to have local control, right? If they want to have point of sale, they can, which is, I think, the right thing to do. The Realtors Association opposes it with that language. They always have, with that language in there.
I do think point of sale has served us well. What it does miss are trust situations.
Right.
Families who have
Right.
trusts in place, especially along our lakes,
Oh, yeah.
and houses passed from kids to kids to kids to kids without an inspection ever being done. And we have no data on those homes to know what the state is.
You're absolutely
septic
correct.
System, so.
Yeah.
Well-
So that risk-based part would capture those, those places within 500 feet of water.
Right.
And based on the conversation I was in addition to point of sale, they are looking at some timeline since last inspection
but it's not going to be as aggressive of 5 years. It'll
Right.
be something further out.
It's 10 years right now. And then, local health departments, which this is key because, you know, we really didn't support a frequency base for doing any evaluation. We didn't, because it's just painting with a broad brush, right? You could have a place, you know, back when it was only 5 years. I mean, you could have a place that, why would you spend the resources to look at a system that was installed 5 years ago, right? I mean, you gotta like focus on the places that are going to be problems. It does have in there, the ability for local health departments to basically waive that frequency evaluation if, when we first looked at it, things were addressed. Let's say they installed a new system, right? So we could basically say, okay, your 10 years is up, but we're going to waive that because you installed a new system. You know, maybe, you know, they've had it pumped once or twice and there's no reason to really spend the resources to look at that.
I mean, some of the systems don't get pumped but every 5 or 7 or 8 years. So,
Oh, that's definitely true. And it really depends on if you are, you know, how many people are living there.
Right.
If there's 2 people living there, maybe you can go that far. If there's 10 people living in that house, you should be doing it
well,
every couple of
besides
years.
the size of the tank and there's
Everything.
a lot
Yeah.
of factors.
Yeah.
Any other comments or questions?
Sorry to keep you, I thought about this when we were talking about septics. Could you please let the board know a little bit more about this new requirement for testing when we're drilling wells? We're trying to create neighborhoods and all that. And that's one more, I think, obstacle in the way of building housing in our county.
Right. I'm glad you asked that. So that is something that has come down from Eagle, through a letter or a memo, and we've had a lot of discussions about that at the Michigan Association of Local Public Health, which I'm on that executive committee for that and the board. We've sent letters to the director of Eagle with no response. We've just had a lot of problems with Eagle, over the past couple of years with things that they are just basically changing without much discussion and more or less edict through memo, like you must do this. And that's one of them. And that's referring to the Part 4 administrative rules for land divisions and subdivisions, and even properties that are split that are less than an acre. Okay. So if you wanted, you know, I'll just take that example because let's say you had, you know, an acre and a half of land, your house is on one side of it, and you wanted to split off the other part to create, you know, maybe you wanted to sell it to one of your kids, or you just want to sell it to bring in some income. And, you know, obviously that would help with our housing situation. It gives another piece of property to build on. So because it's 3/4 of an acre, it would be subject to this requirement to do water testing, with 11 different parameters, including radioactivity, PFAS, inorganic, compounds, organic compounds, metals, like this whole host, right? And this could be out in the middle of a state forest area, right? Where we're clearly miles away from any potential sources of contamination. So this is a big issue. And I actually have been talking to Representative Roth about this. And on June 23rd, the House Oversight Committee is actually bringing in Eagle in front of that committee to talk about some of these things. So tune in. So
Thank you.
I'll be interested to hear what they have to say, but it is, to me, I mean, for just creating these extra regulations in a situation when we are critical as far as like having property available for housing and things like that is just not right. I mean, I'm all for, I mean, don't get me wrong. I mean, in public health, like if there is a reason, like if we know like, oh, there's a place over here where they have leaking underground storage tanks. Yeah, we need to do these extra samples, right? We need to do that because we know that there is this area that there's been some known contamination, or even if it's not even known, like if it's near an industrial area or something like that, by all means, right? Let's do that. But it just doesn't make sense to paint that with a broad brush.
Didn't you say originally that there's no place in the state that can do the list that they had, that Eagles list, but not be tested at any place in the state or any laboratory?
Not in the state lab. I know there were they were trying to figure out like what the actual cost would be. And we were getting into the, about the $1,500 to $2,000 range to test for all these different parameters. In which, if you're talking about a subdivision development, maybe that's a little bit more palatable because there's a lot of money being spent and, in the big scheme of things. But I just worry about it for like these very small developments. You have 10 acres. Now the Land Division Act has changed, right? You might be developing smaller parcels. And if they're less than an acre, you're subject to this. So.
Very good. We probably need to wrap up this subject. But Dan, we appreciate you being here.
Thank you very much.
And,
Glad to be
look
here.
forward to your next presentation.
All right. Next week.
Thank you.
Or next meeting.
So typically we'd like to take a break at this point, but I'd like to push through unfinished business if we could. And because I don't think that'll take that long. Although, does anybody, I see any grimaces? All right, why don't we move into unfinished business and we'll take a break.
So unfinished business is discussion regarding the road commission and the bonding process. So to date, Kelly and I have been participating in a couple of online meetings with our financial advisors and the different bonding agencies, S&P and those sorts of things. And Kelly and I have given quite a bit of information to the financial folks related to our auditing, our top 10 employers, what our audits look like. Do we have any tax appeals? Those sorts of things. They use all this information to really determine your bonding status as you move forward through that process. So the Road Commission is here today to, one, give an update to the Board of Commissioners. They have been moving through the process with working with the construction manager and the architects to really develop the plan going forward, what the building's going to look like, what the rough numbers are starting to look like, and those sorts of things. So Troy and the group are here to answer any questions that the Board of Commissioners may have. You did have quite a few attachments in your packet related to the Road Commission, so you could review those documents and hopefully you have questions for them. From a bonding standpoint, though, the next steps are on the 24th of June. Kelly and I will participate in a call. And on that call, what they're going to do is provide the bids of bonds to us. So essentially the agencies that are looking to finance the bonds, they will provide us the interest rates, the terms, and those sorts of things. On the 24th, we make a determination as to what's the best fit moving forward. And then from there, the attorneys, Pat McGow and his group, they will put together the official documentation, which will be signed by both the chair and the clerk of Benzie County. At that time, the funds come to Benzie County, and we hold those dollars while we work through this project. As you know, the county holds the road commission dollars and then they spend the road commission dollars. So we'll hold those dollars and work closely with the road commission, Joe specifically, to make sure payments are being funneled accordingly and those sorts of things. Now, when it comes to the bonding, we were presented with essentially two options. When the bond bids, I'll call them, come in, there's two options. There's one that is lowest interest rate, 18 million, period. And then many times there's the option of a little bit higher interest rate with additional coupons you receive up front. Those coupons are additional dollars above and beyond the 18 million. Now you're still only bonding $18 million. What you're doing is you're paying that back through a little bit of a higher interest rate. So there are two options. And so what I would like to include in this discussion and hear from the Board of Commissioners today is, do you want to consider that separate option, or are you committed to 18 million, period, lowest interest rate? That's how we're moving forward. So that's kind of the options that we need to work through here really quickly. But Troy is at the podium. I'll kind of let him go over the project as it stands today, answer any questions you have related specifically to the project, and then we can move on into the bonding side of the story.
Sure. And Troy, just to set the tone, we've talked a lot about the building. We've had this in our packet. Let's open it up to questions as quickly as we can so we can go to the bigger question, okay?
Sounds good.
All right, please.
Troy Hines, Benzie County Road Commission. Here today, just kind of brief update. OAK did send out the pre-engineered metal building package. That had came back with, I believe they said, a record amount of bidders on that package, and it was actually $600,000 under their estimate. So that's so far the only thing that we have bid out. Everything else you see in front of you currently is an estimate. I believe the numbers you have right now are 20.17, 20.1 mil, 20.2 mil. That also includes an $830,000 contingency, $345,000 worth of soft cost, and $365,000 worth of furnishings, which are all up in the air currently. The contingency is, we've agreed upon the contingency to wait till the end of the project to see, you know, where things come in. But as far as the dirt work, we've got soil borings. We stripped all the asphalt out over there. We're planning on doing all the topsoil. We're going to do all the backfilling ourselves to get everything up to rough grade and try to save as much money as possible.
So I appreciate the brevity of it. I'm going to start with the first question. So the number we have been looking at here, in a conversation that I've had with the road commission, you've already fronted some of this money. So and you're doing some work in-house. It's actually going to reduce what the number we see. Is that correct?
Correct. Yes, we are doing all the dirt work in-house, as well as the asphalt and the paving afterwards.
How much does that save the road commission?
So the number that we had at the last meeting was 20.9 million. So far we've taken almost $700,000 off of that just by taking the dirt work out. The asphalt as well is actually on the back page of that. It's about 250,000, 260,000 that we're taking out of that package. And when we take stuff off of this bid tab, it takes numbers off of our construction manager as well, because they're based off a percentage of construction. So the savings that we are saving are actually a little bit higher than that.
Very good. I'd like to open it up to the board.
I was the commissioner for the last road commission meeting when these numbers came in, and I raised my hand and said, we have an $18 million bond and projections that come in over that. And you're not concerned about that. I think that's the message. I think that's what we want to understand, that any overages you expect to be reflected in the contingency not being used or the work that you're going to do. This does not give you pause on this project, the numbers that came in.
Yeah,
That's correct?
We're not worried about the numbers.
How high is the building? The picture that's in the packet, I mean, I see like the working area looks extremely high.
So the front of the building, I believe, is 33, 35 feet. And then it tapers all the way back to the end.
Oh,
So the
okay,
33 to 35 feet is to be able to raise the lead boxes up without smashing through the ceiling. Those lift quite a ways up there. Brenda, we can't lift a dump truck box in our building, so.
Thanks for taking the time to be at that meeting.
Oh, we rotate. It was just my turn.
Any other comments or questions you want to offer?
I was impressed with the thoroughness of the presentation. I mean, it sounds like they're going step by step what they need to do. They're looking at the numbers every step of the way. They've made a commitment to the county as far as keeping money in reserves to make their payments. They're not wavering on that. There's no conversation about that. I left the meeting as confident as I was going in supporting it.
On the subject of the reserve that's going to be put in place, those 3 annual payments or something close to that, what's the timing of funding that?
Funding, like backfilling what we've paid out. Is that what you're saying?
No, there was approximately $3 million that was assured would be dedicated to future payments in case there's ever a hiccup financially. When does that piece of it get funded, and how will we be able to monitor that?
Currently, that bank account sits at, we got Joe sitting here, but currently it's sitting at 3.7 million is what we have in there currently. We plan to have that money in there by the first repayment, which is July of 2027, I believe, on the bonds.
And is that mixed in with your general surplus?
No.
Or do you have that as a separate line item?
We started this project with 3.7 million in the bank currently. Our plan, at least, is, you saw there's $2 million shortfall. $2 million of that 3.7 is going to be applied against the overage, leaving us 1.7. We'll have over 1.7 million from this coming fiscal budget year from our general funds to cover year number 2.
And with the general fund increase we're going to be receiving from the marijuana tax and the corporate income tax, should be able to get the third before we're said and done with the building.
I understand that there's some jeopardy for the marijuana and corporate income tax coming your way.
We're treating it as found money, but we're not counting on it completely, but we still, the revenue stream is 1 million to or more higher, even without even that consideration.
Okay.
So we've got that contingency covered. We planned in ahead of it. We have to, we have plenty of time to get that 3-year buffer up, depending on what the actual bond interest is going to be. But right now, the idea is we'll have at least 2 years going into construction and year 3 from the additional funding. If we have to go an additional year in the following year, we can do that too. So I'm not too worried about making that goal.
And in order for us to monitor that, will we be able to see that in your audit where that money's set aside for that?
No, what you're going to be receiving, you're going to be receiving a report. We talked about our last meeting. Commissioner and I was there. We're going to be presenting a spending as you go every month, giving you a comparative to budget to the expenditures year to date into 3 categories, one of which is construction. The other 2 are architectural and construction managers. And you'll be seeing that on an ongoing basis along with the cash balance. Our investment account, which is the Michigan class account, that's where the money is going to be housed at. So when we get the $18 million, Kelly's going to put that 18 million along with that 3.7 together. And then that's going to be the actual balance you're going to be seeing. So you'll be receiving monthly reports from us, at least, to fully transparent where things are going.
Okay. Very good. Other questions or comments?
Ellie, where's Michigan class at on interest? 3.7?
Is there an action item we need to take here today, Beatty?
So what I need to hear from you is the bonding options. So because on the 24th, when Kelly and I are in that meeting with Troy and others, we have to be prepared to make a decision in a somewhat timely manner, whether or not we're going to consider the option with the additional upfront coupons or not. So what I need to hear from the Board of Commissioners today is, you want lowest interest rate, 18 million period, or do you want to consider a slightly higher interest rate to allow for upfront coupon payments made?
I'd open that for discussion.
Well, they asked for 18 million, that's where I'm going.
Okay.
It sounds like they're prepared for 18 million anyways.
Right.
I mean, they're not asking for it. So my guess would be stay with the lowest interest rate.
Okay.
That'd be my support as well.
I would not support additional interest.
Lynn,
Yeah, I guess make it unanimous.
Art?
Yeah, so let the record reflect that we're supporting an $18 million bond. And we'll do that without motion, just document it that way.
Yep. So the resolution that you adopted to really start this process gives me the authority to sign that document on the 24th. I needed to hear from you the document that I'm signing, and I know that I am looking at an $18 million bond with lowest interest rate. That is what I'm going to be signing, and Kelly will be on that call with me.
Very good.
Do you think we could hear from a representative of the road commission board as well? Maybe they have a different vision on some of these things. I think Mr. Rosa is in that capacity.
Thank you, Bob.
Yeah.
Yeah, I agree with all you guys. The 18 million's enough. We don't want to pay a higher interest rate and get hung with that for the list of the time of the loan. It's better.
There you go. See, now I'm happy.
I just had to give you the options because I was given options, so.
I'm trying to see you walk up here.
Sounds like we're all on the same page, and we'll be getting updates as the project moves forward.
Right.
Sounds good.
All right, thank you. Thank you. All right, so we're at 10:43. Let's take a break. 5, 6, 7, 8 minutes if we could.
Okay.
Bring this- What's that, Bob?
Back in session.
Thank you. Back in session at 10:53. And let's move into new business. Katie?
Yes. So the first thing under new business is consideration of adopting a resolution related to deferment of winter taxes. We don't currently have this in place in Benzie County. What this allows for is for folks to defer their winter taxes to a later date. And typically then those folks would pay winter and winter at a later date in the springtime. And they do pay penalty as well. We just don't have that. So this essentially stops it from foreclosure a little bit longer. Is what it looks like. And so a lot of folks, for instance, like farmers specifically, they'll defer their winter taxes until later because they get a farm credit back on taxes through the PA 116,
You
216.
can refer them to the.
They can
Oh.
defer them even further too. But right now in Benzie County, they're not allowed to do those things because we don't have this resolution in place. Most of the counties actually have a resolution in place. Kelly and I didn't find one here. So in order for this to work and to be allowed in Benzie County, you have to adopt the resolution allowing for the deferment of taxes.
I didn't know that. I thought we were covered.
We did not actually have this authorizing of deferment of winter taxes on file that we could find.
Katie, doesn't this though include the waiver of penalties and fees?
Yes. For a period.
I thought so. Does that give, it's at your discretion then?
Yes, here.
Well, it's, as you can see from the resolution, it's for 62 or older.
Mm-hmm.
Any disability they might have. That last line really, 9 times out of 10, veterans already are exempt. $40,000 or less. So basically what we're doing with this is we're giving those people that come in every year and use their income taxes to pay that extra time to do so without accruing those penalties and interest.
It essentially lets them get their tax return back to then pay the tax.
Correct. Because not everybody gets their tax return by the 14th of February.
Right.
Most people are just
Wow.
at that time doing them.
Here.
So in this age bracket, as our population is aging, we're giving those people that extra month and a half to get their taxes in and pay. And then they have to pay by that date or before, or we add it all back on. So, and a lot of counties are doing this. I didn't realize this was a thing. I know Grand Traverse County does it. Manistee, I'm not sure on, but I know there's quite a few in the area that do it. We already offer summer deferments out there. The townships offer that. So you can defer your summer taxes till February 14th with no interest. There aren't penalties then. Penalties don't kick until after February 14th. And so this is just an extra added bonus to help those that are out there struggling. They can continue to make payments if they're struggling. They can pay, you know, at the township, they can pay their $50 a month or whatever they want to pay. And they can do the same thing once it floats over to us, make those payments. And then once they get the rest of their money in, pay it off. They didn't pay interest and penalties. And it's just an extra added thing that I thought would be great because we get that. We get a lot of that around here. People just, well, I'm going to get my taxes back in 2 weeks and I'll pay it then. I'm like, okay, perfect. But now we can do it as long as they qualify, you know,
Sure.
for those extra little things there.
If the taxes and interest are deferred and the payment is not made, is it calculated from the time of the deferment or is it retroactive to when it was due?
It's retroactive to when it, so the summer, if for some reason they include the summer on this,
Huh?
then it goes back to September 15th. Yeah.
I
Feeling?
do have a question about the agricultural. 'Cause
Yeah,
I
we left
don't
that
see
off.
Anything in here? And is that part of this deferment or I thought agriculture was kind of automatic. You just come in and make the request and only have to pay it once a year. I don't.
That's a
It
good
needs to be in
question.
there. Should
Sounds
it
like
be
I
in there?
need to do some
It
research
look-
on that part.
It looks like we should add it to the resolution based on the General Property Tax Act of 2000 or 206 of 1893. It looks like we have to add in the agriculture on this resolution to include it.
You got an open bullet item that you can place it there.
Yep. Hey, sorry, I had a typo.
Yeah.
So what would that language look like to, if you wanted to add it?
Properties that meet the qualification of agricultural exempt.
Does it need to come back? Are we going to amend it to include that?
That's up to this board if you want to add that to the
You don't want
bullet.
approval to it without that in there, do you?
Well, you could make that part of your motion if you wanted to, that you're adopting the resolution with the addition of agricultural exempt properties. You could do that if you wanted to. Or you could bring it back. It's your call.
Tammy's putting that in the minutes right now.
That's a motion I'll make.
Okay.
With that addition? Yes.
And what's the resolution number?
2026-017.
Is there support?
I'll support.
Additional comments or questions?
Right. So we're approving verbiage we haven't seen.
You want to read it back?
No, I mean, I understand what the motion is, but we're adding a section to a document, to a policy that we haven't seen.
We're just adding one bullet point.
Just a bullet.
Yeah, you're adding a bullet point under the list of be it further resolved, and then it lists the 62 you're gonna add agricultural qualified property.
So instead of 4 bullets, it'll be
That's
5.
what, thank you.
Correct. Yep, not a whole section.
Okay.
No.
Not a whole section.
Additional comments or questions? If there's none, let's do roll call.
Matthews,
Yes.
Nye,
Yes.
Roloff.
Yes.
Sauer,
Yes.
Janat,
Yes.
Markey,
Yes.
motion carried.
All right. Thank you, Kelly.
Yep. The next item on the agenda is also related to what Kelly talked about this morning in her update. This is an amendment to pay out those unclaimed proceeds settlements that are this fiscal year, so yellow. The green and the red will be next fiscal year, so we're working to budget that within the budget. But to pay out the yellow ones, we do have to do a budget amendment so that we can make those payments, because right now it's not budgeted to that amount.
Okay, this might be a silly question, if I might.
Please.
But these payouts that we're making, and then the section below it on our sheet, it says duplicate claims. Are these people being added into the claims at the top?
Nope.
No.
No, duplicate claims are claims that have 2 or more people claiming on
None of
them.
these in green are affiliated with any
Nope.
of the ones in yellow.
Nope,
Okay,
the
'cause
ones
it
in yellow
concerned me-
only have one person filing a claim.
It concerned me if we were
ones
paying
in
it out
green-
in yellow and
Nope.
green was having
Nope.
claims dependent on those.
Nope,
Okay,
nope, though, that's why I separated them out
all
that
right,
way.
all right.
Yep.
It would be hard to get that money back
Right. Right.
once paid out.
I'd entertain a motion if you're ready.
I'll go and do it. Matthew moves that the Board of Commissioners authorizes a budget amendment in the amount of $251,000 in the Tax Administration 532 Fund related to class action litigation payments.
Your support?
9 seconds.
Additional comments or questions? Hearing none, roll call, please.
Nye,
Yes.
Roloff.
Yes.
Sauer,
Yes.
Janat,
Yes.
Markey,
Yes.
Matthews.
Yes.
Motion carried.
Are you dealing with the next one?
I can introduce it, and then if there's questions, I'm sure Under Sheriff will take
Very
care of
good.
it. So the next item in your packet is related to Sheriff's Office equipment. There are 3 pieces of equipment that we're looking to declare surplus and authorize their sale. One is the trailer that is used for the dive team, and those funds would be deposited within the 234 dive fund. And then the other is 2 Dodge Journeys, and those would go into the 425 equipment replacement fund. And those proceeds then are put towards the newer vehicles that we're using, that we buy to replace these vehicles. So the question is just that, to ask to declare them surplus so that they can be disposed of.
Is there any questions for the undersheriff? Do you have a comment you'd like to make?
Yes, one is a Dodge Journey, which was the detective vehicle. The other is a Dodge Charger that was a patrol vehicle.
We replaced the cargo trailer.
No, that
We're
was,
going to.
we are not. That cargo trailer was donated in 2005 when we had a Benzie County dive team comprised of fire departments and divers, and used for that. It hasn't been used since I've been here. And it's time to move on and get rid of it. That's why the money would go back to the dive team, because that's why it was donated for that original dive team. So this will go, we've switched over to the mutual aid dive team.
Do we still have participants on the dive team?
We do. We have one participant on the dive team for the mutual aid dive team, Deputy Kozlowski.
But for purposes of the motion, is the 2017, the Journey or the Charger?
It is the journey.
Journey.
I will go ahead and make the motion then that the 2005 Roadmaster cargo trailer be declared surplus and authorized for sale, with sale proceeds to be credited to the 234 Dive Team Fund, and the 2017 Dodge Journey and 2021 Dodge Charger be declared surplus and authorized for sale, with the sale proceeds be credited to the 425 Equipment Replacement Fund.
Matthew supports.
Is there any comments or questions? And the only question I have is, the memo shows them both being journeys.
Yeah, I messed up.
That's okay. All right. And you'll show that correction. All right, let's go. Let's take roll call, please.
Lots.
Yes.
Yeah, Rhonda said it right.
Howard,
Yes.
Janat,
Yes.
Markey,
Yes.
Matthews,
Yes.
Nye,
Yes.
motion carried.
Very good.
Thank you.
Thank you.
The next item in your packet is the purchase of a lawnmower. This was discussed at the Buildings and Grounds Subcommittee level a few times, actually, and it's been on the capital plan for, I think, 2 fiscal years now. And so what is being presented to you is the purchase of a stand-on lawnmower from Ferguson's Fireplace and Stove Center, related to the quoted amount. This is within the budget that was in the capital fund, actually. So we had budgeted about $15,000 in the capital fund, and this is coming in at under $14,000. There was a lot of discussion related to this because it's really sticker shock for a lawnmower, because most of us are used to just buying our Cub Cadet Husqvarna for our homes. So it is a bit more expensive. The idea of this too is one mower for the campus. So the maintenance folks will be sharing this mower versus having 2 separate mowers as well. And there was a lot of discussion about the safety of the stand-up mower, given the topography of our campus. We have a pretty hilly campus, and sometimes it can be a bit frightening to slide down a hill when you're trying to mow. So the idea of the stand-up as well is a little safer for those folks. So if there was to be an incident, they can jump off that versus maybe being rolled on by a lawnmower. I did give you all of the quotes that were obtained for the various types of lawnmowers, but ultimately the Buildings and Grounds Subcommittee is recommending moving forward with the stand-on lawnmower from Ferguson's, which is a Skeg stand lawnmower, not the Toro.
Is there questions?
What are we doing with the old mowers? Yeah, any value at all?
I know the one that they still plan to kind of keep and use it as like a little tractor because it works really well with the cart. As far as the second lawn mower, I'm not sure yet what we're going to do with that. I haven't talked to Kyle about that second mower, but the one is kind of a nice little just tractor to, they do a lot of landscaping out there and they're always moving
Got a tractor.
leaves well, sometimes it's nice to just have a little mower though. You can't have too many tractors.
I know that. I was a little shocked when I looked at the John Deere price. Jeez.
Yeah, I had sticker shock. This is not my area of expertise. I needed to go to subject matter expert, made some phone calls, and this person was not phased at all.
Yeah.
By the price, and said we should see at a minimum 15 years life out of this, probably more. Was impressed with the brand. So that helped me to get some additional information.
Ultimately, it's in budget and was planned for on the approved capital plan.
Cool. I'll make the motion that the Board of Commissioners authorizes the purchase of a stand-on lawnmower from Ferguson's Fireplace and Stove Center as quoted on May 12th, 2026, with funds available in the 401 Capital Fund.
Support?
I'll second.
Additional comments or questions? Katie, typically in our motion, we'll state the dollar amount. Is there a reason why we're just referring to the invoice? for the bid?
I probably messed up again. It was a rough week. So
You want that in there?
yes, you should add the dollar amount in there.
In the amount of $13,578.
Yes.
Yep.
Your support?
Oh, yeah, support that as well.
Great. There's no additional comments or questions. Roll call, please.
Sauer,
Oh, you're asking me?
Yeah.
Yes.
Janat,
Yes.
Markey,
Yes.
Matthews.
Yes.
Nye,
Yes.
Roloffs.
Yes.
Motion carried.
Sorry about that.
Are you or Tom introducing the next one?
Either, kind of the same situation. So this did go to the Buildings and Grounds Subcommittee. This is for paving at Station 3. Many of you, who have been over to Station 3 for like the open house that we had, you saw that it is a dirt path there. And so this is to pave that pad there. The Buildings and Grounds Subcommittee did consider the quotes and is ultimately recommending Ron Brown and Sons. This is also budgeted with funds in the 210 EMS fund, so there are funds for that. And this was on the horizon as far as considering this. It was not part of the overall project cost.
Any questions or comments for Katie or Tom? At that additional spot at the building?
You want to explain exactly what's being paved there?
Exactly where it- I think I can.
Good afternoon, Tom, Director for Benzie EMS. You're asking exactly what's going to be paved or proposed to be paved. So right in front of the addition, extending out to make basically 4 parking spots that'll be paved. It's all rough gravel dirt right now, and they're tracking that all in on the brand new flooring. And they're gonna destroy that brand new flooring if we don't put paving down. So that's why we
Does it
decided.
need to be excavated? Is it level?
It's level. They'll have to come out and do some leveling, and then the projects have outlined how much pavement is going to be put in. So
And also like to add that Ron Brown and Sons was a lot cheaper than even the next closest, if I recall correctly.
yeah, about half.
Homer's is getting that bad.
There's also the concern of that getting washed out over time and
Correct. In fact, we're actually having that on the far side. If you go along the far edge from where the slope that goes down into the Maples, that roadway area, when we had our heavy torrential spring floodings, started to wash that out. Because when they did the building, they had to remove some trees. Kyle's actually going to rectify that and work on that and rescape that whole area there. So we're gonna fix that problem internally at a minimal cost.
okay.
He's gonna drive the Kubota the whole way.
There's other comments or questions? If not, I'd entertain a motion.
Okay, Matthew proposes that the Board of Commissioners authorizes the proposal from Ron Brown and Sons for paving at EMS Station 3 in the not to exceed amount of $7,612 with funds available in the 210 EMS fund.
Sauer will second.
Any comments or questions before we call for the vote? Hearing none, roll call, please.
Janat,
Yes.
Markey,
Yes.
Matthews.
Yes.
Nye,
Yes.
Roloffs.
Yes.
Sauer,
Yes.
motion carried.
Very good.
The next item I'll let the undersheriff cover. This is related to the sponsorship of police recruits to go through the MCOLS program. We have entered into a partnership similar to this one other time in the past, and it was very successful. That deputy is still on the road. And so I'll let undersheriff give you the rest.
Good morning, Under Sheriff Greg Hubers. As Katie stated, in 2023, we sponsored Deputy Morgan Cook then, Deputy Morgan Drager now, through the academy. The board had requested after we approved the request for funds from MCOLS. It's a grant from MCOLS to pay for them to go through the academy, and it pays their salary while they go through the academy. It worked in that case very well for us. Everybody, every graduate of the last academy at NMC was sponsored by somebody, meaning nobody in there didn't have a job when they joined the academy. It's kind of the trend and the way things are going. When I started, nobody had a job when they went through the academy, and you interviewed with several hundred other people, but that has greatly changed. What we're asking for today is the chair's signature on the contracts for both of those, for those 2 individuals. One is from within the the sheriff's office, Deputy Victor Moore from the correction side of things. And the second is for Christian Flynn, who will also be our formerly known as mental health officer or crisis response deputy upon graduation and some additional training. This contract was approved in 2023 by Costoker and Toskey. They actually drafted it. I just retyped it and tweaked the names. So it's the same as the 22-23 one that was approved by Costoker and Toskey.
Questions or comments for the undersheriff? Greg, I would have is this on a reimbursement basis or do we front load this?
No, it's not. They pay for the cost up front for the academy, and then it's reimbursement for the salaries.
Would we be more effective or successful in recruiting people if we front loaded it rather than did a reimbursement?
No, I don't think it would matter either way for us. Go ahead. I don't know what you're.
They're not front loading it.
Yeah.
The state is front loading to us and then we're getting reimbursement for what's needed. The applicant itself is not having to seek reimbursement.
they
The
don't.
county.
That's what my question
Okay,
was.
that's what I thought.
Yeah.
Yeah.
The state pays their tuition right up front before they start through MCOs. And these are limited funds.
Mhm.
The word right now is that they're going to dry up somewhere in the end of July and we wouldn't have that opportunity again till next state fiscal year. So we're moving now. The reason we have two, like I mentioned before, is to replace Suzanne Mall and to replace myself. That person that graduates from the academy is not going to be the next undersheriff, but the plan is to do that from within. So we'll have a second vacancy. The timing is perfect. They will graduate in late December. And I'll be leaving in early January, so we'll be able to roll right in there without affecting the budget or the roster.
Not July, right? You're not leaving.
It is not July,
I don't-
and I'm sorry that you heard that. I did get an apology from that person, so.
And my other comment or observation would be, I'm glad that we're using the attorney to prepare these things a couple of years ago, but laws change. Is there any value in us having them eyeball it one more time? Because I don't know about the legalese in this, but sometimes rules do change and we're not even aware of it. And it's been 3 years.
I'm very comfortable with it, the way it's written. But if you request that, I can. I just don't want to lose that time because that money's running out in July, or it could be running out.
I'll tell you what, I'll leave it up to your discretion, but again, sometimes things change. We don't know they've changed. The language becomes obsolete. It's been 3 years, but tell you what, I trust your judgment.
Thank you.
With that said, it's in the motion, subject to approval as to its form by legal counsel. Do we want that in there then?
Up to you.
All right, I'm going to make the motion that the Board of Commissioners approves the grant application for the Public Safety Academy Assistance Program and supports the sponsorship of up to 2 individuals into a certified police academy facilitated by Northwestern Michigan College, and further approves an agreement memorializing the relationship between Benzie County and the individuals selected to complete such police academy, and authorizes the chair to sign.
Markey will support.
Other comments or questions? Hearing none, roll call, please.
Markey,
Yes.
Matthews,
Yes.
Nye,
Yes.
Roloff.
Yes.
Sauer,
Yes.
Janat,
Yes.
motion carried.
What I would encourage though is in the meantime, because we'll probably see this again at some point in time, another year, so let's get that updated by the attorney.
The next item is also for the undersheriff.
The next item is the Marine Safety Program grant acceptance. Like in the past, we've been awarded either a federal or state grant program for our Marine Patrol. The state determines whether it's federal or state, depending on what's available in those funds. This year it is a federal grant program. There's nothing really different in the two. The reporting on our end is a little bit different in what things we have to record as far as contract. Last year we were awarded $6,000. We bumped up our request this year up to about 18,000. and we got 11,000. So we have $5,000 more for the Marine Patrol this year, which is huge for us.
2 boats,
Three
3 boats.
boats. The one thing that additional money helps us do is get some much needed repairs to our Lake Michigan vessel, and those have already been completed.
Is there questions or comments? I'd entertain a motion.
I'll make a motion that the Board of Commissioners accepts the Marine Grant Award in the amount of $11,000. Authorizes the undersheriff to sign the 2026 Marine Safety Program federal funding grant agreement with the Michigan Department of Natural Resources and approves the necessary budget amendments for payment and reimbursement related to grant award.
I'll support.
Thank you. Any other comments or questions? Hearing none, roll call, please.
Matthews,
Yes.
Nye,
Yes.
Roloff.
Yes.
Sauer,
Yes.
Janat,
Yes.
Markey,
Yes.
motion carried.
Okay,
Still the undersheriff.
vehicle sales.
Um, several months ago, we did sell a vehicle through the My Bid process. We are asking now for the budget amendment to recognize those proceeds and have those monies put into the 425 equipment replacement fund. That's the amount of $2,263.
There's no comments or questions.
I'll make
Look
the
for-
motion that the Board of Commissioners authorizes a budget amendment in the amount of $2,263 to recognize revenue and related expenditures in the 425 replacement fund.
I'll support. If there's no other comments or questions, roll call, please.
Nye,
Yes.
Roloff.
Yes.
Sauer.
Yes.
Janat,
Yes,
Markey,
Yes.
Matthews.
Yes.
Motion carried.
thank you.
Thank you.
Katie, why don't you take the Construction Board of Appeals, please?
Yes, so in your packet, you will see an application for the Construction Board of Appeals from Dave Gardner. The Board of Commissioners has already appointed 3 folks to that board, which is the minimum that that board has to have to meet. In the past, we have had up to 5 folks serving on the Construction Board of Appeals. So while we do have 3, which is the minimum to meet, and they did have their first meeting yesterday, I did want to give this to you as well because we do have this on file. He is an eligible applicant, and it would be up to you if you want to then make that board a 4-person board or keep it as a 3-person board as it stands. We do have an active appeal. This is the first active appeal in probably 10 plus years. We don't really get these very often. So this board almost never meets, but it is actively meeting right now.
Katie, my question for you is that we have 3 people appointed.
Correct.
There's very little activity.
Correct.
Other than it's great to have another qualified candidate, is there a reason why we'd want to expand that beyond 3?
It's really your preference as the Board of Commissioner who's the appointing authority. You don't have to, but I did want to give you the opportunity if you would like to.
Any comments or questions?
My comment is that would put 4 people on there, and that's me is an issue. You had 5, it'd be different. 3's plenty.
I think it's a great insurance policy. If one can't make it, I mean, the time of year, you never know. I mean, if he's qualified and willing to serve and only 3 can make one of the meetings, at least it's a little bit of a guarantee of at least 3. But I do to your point, if they all show up.
But with the boards that I see, a 2-2 vote gonna happen very often, and if it does, it does. Right?
Well, 2 to
fail.
2 would be by like default failure. Yeah.
Say that again, Katie.
The 2 to 2 would be by default failure.
Right. You know, there's one way to cure that, and that's to make this appointment as an alternate.
Mhm.
So that if they don't have 3 people showing up, then they're in, but it avoids that split vote.
Can we do that?
Mm-hmm.
I'll make the motion that we appoint him as an alternate to the Construction Board of Appeals.
9 seconds.
Other comments or questions? They require a roll call.
But should there be a term on it?
The other ones are all 3-year terms.
So expiring June of
29,
9.
yep.
Okay.
Other comments or questions?
I would just, how is the current board? I mean, I haven't really seen or recall seeing any applicants for this board ever.
You've appointed them over the last 6 weeks. Sean Duperrin, Roger Papanaugh, and Brian Childs. Yeah,
We just did, you may have missed a meeting even,
Yeah.
but we just did that in the last 60 days.
correct. Yep.
I remember one of them, but I don't remember all of them.
And again, that's not a board that's been, when's the last time they met? Years.
10 plus years.
All right, let's do roll call.
Roloffs.
Yes.
Sauer,
Yes.
Janat,
Yes.
Markey,
Yes.
Matthews,
Yes.
Nye,
Yes.
motion carried.
On the agenda, we also included a potential appointee for the DHHS Maples Board. We had an interview yesterday with Gary, Lynn, and myself. You have a memo that was provided to you at the beginning of the meeting. Gary, would you like to speak to this?
Well-qualified individual. I don't see any reason why we wouldn't appoint her. That's kind of recommended by the board chair too, which makes it a little solider for me, so.
Let's be clear, that's the board chair of the Maples.
Of the Maples. So I'd be happy to make the motion that was our recommendation, that we appoint Gretchen Classens.
So you started to make a motion. Do you want to do that? And then we can open a discussion if we have to.
I move that we appoint Gretchen Classens to the, got one? I didn't read it. Okay. To the DHHS Maples Board, seat previously held by Bridget Hazick. Term expiring October 31, 2029.
Support. Any other comments on this? Hearing none, roll call.
Bowers,
Yes.
Janat,
Yes.
Markey,
Yes.
Matthews.
Yes.
Nye,
Yes.
Roloffs.
Yes.
Motion carried.
Very good. We're moving into commissioner reports. We'll start with Rhonda today.
Okay, I attended agenda review, covered everything that we talked about. I attended the road commission meeting. We talked about pretty much everything there that was discussed. They did approve a dozer rental from Honor Excavating. Bob Rosa had to abstain from that vote. There was one other bid, McAllister. They only used that for a comparative because the bid was 15 minutes late coming in. I attended building and grounds, which we've pretty much covered with the lawnmower purchase and, what else did we do? Oh, the EMS paving. We, reviewed again a video surveillance policy, which is moving forward for further review before it comes before us. Talked about camera door swipes at animal control. Rebecca Hubers is following up on that. I attended the Village of Benzonia. They accepted a bid for a crush and shape on Lake Street. They had two bids, which were actually pretty close, 220,000 and 226,000. JNN and Elmer's were the bidders, and they went with JNN. They approved their L4029. They discussed, they have a company coming off their tower. They house 3 cell services on their water tower, which has been a really great income to their water fund for many, many years. One of them is coming off because of the weight of their equipment and is questioning the village about another site. They own some property at a slope site on Severance Street. They would need 100 square foot footprint and are offering $900 a month, which is well below what they're paying now. It's a little bit problematic because that site is an alternative for another well site should the village need it down the road. And you always have to prepare for what you might need. So they'll be talking about that into the future, what they're gonna do. Matt Jason is the new trustee. Meg Ackerson is their new clerk. And at the Village of Benzonia, all trustees need 4 hours of training, which they have to document. And that's part of their redevelopment ready community requirement, which I thought was pretty cool. And they are reviewing a special event permit. They just had a draft policy for that, talking about that. I attended the Central Wellness Executive Committee. They recommended the purchase of 4 cars up to 47,000 all-wheel drive. They're replacing 4 2017s. They turn them in at about 100,000 miles, so they will be advertising those for sale. Sometimes they're sold internally at Central Wellness, but they do have to advertise them. Chip gave an update on the rural effort. About 8 of 10 rural entities are on board for what's the name of the health?
Gets worse.
Yeah, I know. I can't think of it. The RFP that was given for a rural exemption.
No.
Bid out?
Yeah.
For the regions?
Yeah, for the one that was formed. They were gonna, anyways.
Oh, the bridge?
Yeah, Bridge.
Bridge is
Bridge
out.
Health. Yeah.
Bridges
Yeah,
out.
so that's moving forward. And Central Wellness had their compliance audit, which comes after their regular audit, and it was excellent for 2025. And then I also brought a flyer, which one of our local banks, State Saving, is offering a financial fraud awareness workshop. And then I saw the date and I was struggled with that a little bit. It's on June 16th, which I believe is our Headley Reset information forum. Okay, well, this is going to be at Grow Benzie, 6 to 8:30. They're going to talk about financial fraud awareness. You do not need to be a member of the bank. There is no cost to become informed. And I was told there really is a need for this kind of information. So I wanted to share that. Well, that's all I have.
Good report. Questions?
Isn't that the group that's gonna have our prosecutor and a couple other folks, plus the banks?
I'm
to
not
talk to
sure.
fraud?
Yes.
It's too bad it's at the same time as the thing. but-
And that, just as a reminder, that June 16th event is being put on by the chamber,
Mhm.
not by the county commission, although we are the agenda, so.
Correct.
Rhonda, a couple questions. Did I hear you right that Central Wellness has a vehicle policy that they change the vehicles at 100,000 miles?
Yes.
Okay.
They rotate their policies. I mean, they have a policy committee where their policies are constantly going through, being reviewed, edited, looked at, and it's pretty, it's very structured.
But it's helpful. And can you elaborate video surveillance? You probably have talked about that before, but what is that all about?
It's a policy that we're looking at. We have cameras and people, there can be signs saying you are under surveillance. So we need policies for the things we have in place. So that's what this would do, is just set it in very clear terms where, what we do with the videos, how long are you being recorded?
Storage.
Rebecca would like to speak to it. Yeah, storage,
Who owns the data?
They'll be coming.
owns the data, and who can access it.
Yeah, the policy will come forward pretty soon. It is out to legal and staff for review since the Buildings and Grounds has made its recommendations. And it's really just that it's, we have cameras in place, and so we have a policy that outlines how we use it, who has access, and those sorts of things.
So it's documenting current practices.
Correct.
It's not adding cameras. Okay. That clarifies it for me. Thank you. Len?
All right, get to follow Rhonda. Yeah. AP approvals on the 28th. That was lots of fun. Building grounds, Rhonda covered that better than I can. All the things we went through. Glad we got the lawnmower. I've tried to flip my Cub Cadet several times trying to my house, but a lot safer, the equipment here. With respect to the 9/11 Central Dispatch Director hiring plan, had a discussion a few days back. We at that point, we were looking at a couple of candidates. Since then, we've added 2 more. So on the 11th of this week, I guess, coming up, we're going to be doing 3 interviews, pretty good qualified folks. So we're looking forward to that experience. We previously mentioned the Maples board too, with Gretchen. bringing her in. Went to the Inland Township meeting last night. Always a blast. They had one of the things I thought was fascinating is I don't know what fire truck tires cost. There was a motion that they went through and approved for $8,751 for tires. I'm thinking, I'm having a heart attack. Yeah, 4 tires? How many tires? He goes, no, that's 10. I said, well, that's a little better, but that's amazing to me how high quality these things have to be, and they're made for such tolerances that it costs that kind of money. And I'm used to that in the Air Force, airport, airplane tires, but that was very I learned a lot yesterday about how things work and how long they last and the need for such tough tires, that kind of thing. So, and then everything else they did was just a whole lot of house cleaning, everything from flagpole lights to changing cemetery signs and things like that. So just a lot of little things over a 2-hour period that, not a lot came up with the, Reynolds Road, dog pound. One quick public announcement thing, and that was it. Nothing, no long discussion, no after action. So I thought that was positive. So,
Lake Ann Road, Doug, though.
the what road?
Lake Ann Road.
Was it Lake Ann? Because I keep.
Lake Ann on 31 was the conversation that was took place here.
Okay, yeah, I thought we. Yep. And then Colfax meeting tomorrow. So that's all I got.
Questions? Gary?
Thought he would have more excitement at last night's meeting. Anyway. You have my report, a couple of things. Joyfield's new zoning administrator is from Muskegon. Seemed exceptionally qualified in their opinion, so that's who they went with. Gonna be some travel time issues, I'm sure, that they're not happy about, but it's a 2-hour run up and back, so every time you call him. But I think a lot of it can be handled over the phone. They haven't had a zoning administrator since I think it started, so we'll see. Village of Thompsonville last night, their new truck is here. Luckily, it fit in the building, so. They were one of the people that works for the village says, oh yeah, it's really nice. It's like driving a big Cadillac. And I said, oh, I imagine. $400 and some thousand Cadillac or whatever it is. Yeah, anyway. They had some concerns with their ball field. Maintenance not being taken care of. And they need diamond dust and all that stuff, and they weren't sure where to get this. To me, like they should have had some better plans, but what do I know? Summerfest is June 15th, next Monday, from 6 to 8. Being on that.
I think the sheriff's office attends that. Summerfest.
Said there was quite a few people up there, and I talked about this public safety money that the townships got. Sure Kelly can talk about it better than I can, but I see that as an issue financially for the townships to get it straightened out.
I've also spoke with Sheriff Rosa about it. In addition to Kelly, I know the treasurers were talking about the public safety revenue sharing. So we're having those conversations to help the townships use those dollars appropriately. 25% of those dollars can be utilized for fire and other reasons. So some of those townships will be able to retain some of those dollars. But I do believe the sheriff was going to communicate as well with all of the townships, in addition to Kelly and I working with them to ensure they're not breaking any rules.
Just trying to give them a heads up to research it. So that's still where I was going.
There's a specific list on what they can
We
spend it
sent
on.
them to some, but not all of them. So
They'll all be getting it. Every
Maybe they haven't
township is getting some money. It ranges from like $300 up to almost $9,000. So some of it's going to be pittance that they're going to end up sending to the county for sheriff's office reasons. But nonetheless, we want to make sure they're using those dollars correctly.
I don't. True.
Yeah.
That's a shock.
Yeah. So Kelly. Yep. Kelly also.
Weldon
communicated-
wasn't there or the village?
Village was not. Yep.
All right, thank you. I'm just gonna keep pushing it a little bit, that they pay attention. And is it this Thursday? I believe so. Frankfurt Area Land Trust is having their
Mhm.
open house to look at everything at 4:30, ribbon cutting.
Yeah.
So, I'm gonna try to make that. And took a walk with Scott Slavin from the DNR about the trail down here in Beulah that was tore up for the drainage. And we have a few concerns that the trail was not brought back to the condition it should have been. And I understand from an email I just got today, they would like to go down and talk about it, and I think Walton Construction did the work. Hopefully we can get this cleared up. It should have been brought back to the original condition, so that's where we're kind of going with that. I think that's coming up, whatever we can decide. So that's about all I got.
Questions or comments for Gary? Gary, just a couple of follow-ups. The part of the trail, was that where the asphalt's laid that they tore up?
Two spots, but Elmer's was fixing the one. There's a little village park. And everything from, I guess, from Beulah, I don't know how far, maybe 700-800 yards. They had closed the road last fall, tore it up, put in drainage things. And when they put everything back together, the landscaping or the black dirt and all that and the trail, I don't think they use quite what they should have done. It's kind of like this, and it's not nice and level like it should be. There's a couple of big washouts that happened. And one of the claims was that it was a sinkhole. There's no way it was a sinkhole. As you first get into Beulah by the park, there is the majority of it, but because some of the property owners wouldn't allow them to work on that, it was supposed to go, I think, darn near to, I can't think of the road. Country, whatever it is, up the hill there. They wouldn't allow them access, riparian rights or whatever it is, wouldn't allow them to do it. So I hope the drainage thing that was a big grant they got from Eagle. I hope that's taken care of, but we just want the trail restored. It's our 10 feet, so that's all we can talk about, so.
Well, what I'm concerned about is that we put a lot of emphasis on the fact that the trail going out of Beulah towards Thompsonville would be snowmobile friendly.
It is.
Okay, that didn't change.
That didn't change at all. This is part of the Bigelow section, the property owner section, but it's in Beulah.
In your report, and I appreciate you providing in advance, you talk about Joyfield Township and requesting a variance for the recycling units. And we had brought that up at an earlier meeting. And Katie, maybe you're part of this discussion, but does that mean, I think it'd be $600 would be a good investment to ask for a variance. Are we going to pursue that?
So we're trying. So Dave requested a call from Betsy, and as of just the other day, he still hadn't received a call from her to kind of talk through all of this. And so that's kind of where we're at. He's waiting to speak to her. He did have an email with her, some more email correspondence about the variance and the $600 fee. And, you know, he was essentially told that you can pay $600. It doesn't mean anything, you know, in the sense of doesn't mean we're going to grant anything. It's just a fee. But he was trying to communicate with her verbally because, you know, email can be interesting, and he had yet to receive a call at the point of that email.
Well, we had suggested that we go for a variance on that, and I still think that'd be worth pursuing. And Gary, the last thing I'd have is in today's Record Eagle, there was an article about Thompsonville, their TARP, Thompsonville Restoration Area, and that park that they're trying to restore. If you get a chance, you may want to take a look at that article. I think it's on page 1. Okay. Tim?
Village of Honor, gentleman by the name of Steve Stevens, he's a volunteer that takes care of the flower boxes in the Village of Honor. Indicated that their new supplier, Pleasanton Valley, is done, that the new flower boxes are on display and look great. And they do. The council is discussing getting the well at Maley Park tested for PFAS. They're waiting to get what the cost for the test are going to be, and they'll probably take action next month on that. The new playground is open, and they ordered signage for it as well. At the buildings and grounds, I attended the Northern Michigan Chambers Alliance Forum on Data Centers in Northern Michigan, Understanding and Planning for Community. That was held in Gaylord. It was actually a video recorded from Up North Live, and the Alliance plans on publishing that once they get done. They want to tweak it and stuff and make it make it available to the public. John Willow, the executive director for the Benzie Area Chamber of Commerce, was one of the presenters. He did a fantastic job. Benzie was well represented there. The forum was to provide elected officials, because they basically invited elected officials to that. And it was to give information, not to develop opinion, basically. They weren't trying to give you the answers. They were just wanted to give you the information so you can make informed decision. Like, for an example, a takeaway would be, it's better to start preparing now, opposed to waiting for the state to make rules that you have to follow, or a developer knocking on your door saying, hey, we bought this parcel, we're developing, if it's into your zoning. Some things to make note, you think of a data center, you think this huge facility that sits on hundreds of acres, right? Data centers could be the size of a boxcar train or shipping container box. I mean, they don't have to be huge. Data centers, even a small one's going to take a lot of electricity, right, and power, and it takes a lot of energy to cool it. So think water, right? Some of the things they talked about was the power infrastructure. The utility companies were there, actually. Consumers Energy was there. And a lot of people, one of the big concerns is when a data center comes in and is being built, I think one of the much larger ones, the data center, the utility companies, the power companies are probably going to greatly upgrade their infrastructure to do so. And they're going to require sometimes new power plants just to power these things. Who's paying for that, right? One of the things to think about ahead of time. They're not supposed to be passing that cost on to the not to the taxpayer, but the residential consumers. You got to be careful about that. Have that conversation. Noise. You think, well, data centers don't make a lot of noise. Well, if you're ever inside of one, they're real loud inside, but outside they can't hardly hear them at all. But almost every single data center is going to have these things called backup generators. Those are usually diesel. Those can get pretty loud, and they actually do. People worry about air pollution. Those are other things to think about. Side note, one of the people in the forum, can't remember her name, Dr. Sarah Mills, I think, from University of Michigan, brought up, talk about noise and air pollution for zoning. You may want to think about all industries, not just data center, right? I mean, so pretty interesting thought about that. Something else to think about, some of these data centers, they're planning on for their power supplies, instead of taping into the your consumers or Cherryland or whomever, putting a small or a micro reactor on site. So you're thinking nuclear, right? And then another last thing I want to talk about is, power is a big thing, right? You know, for cooling, for everything, you know, inside these data centers. The computers themselves and storage, they don't like their power to be interrupted. So they have this buffer in between, an uninterruptible power source. Think batteries, big, right? Your local first responders in the last several years have learned that these batteries are hard to put out. Think electric cars, right? So when they come in, got to talk about, okay, are we updating our local first responders to be able to handle something of that size if it does catch fire? Okay. Another takeaway, which was pretty interesting for this, was just because they're coming in doesn't mean that the municipalities just have to, okay, you know, you fit our zoning, we have to do whatever you. It's an opportunity sometimes. There's several that actually built right into the contracts with the providers that are building these data centers, things to do community improvements. Maybe a new park comes out of this, maybe some additional infrastructure. So just because they're coming doesn't mean that the municipalities have to just accept everything. So, I mean, there's opportunities, like I said, maybe we do have some improvement, things that we can do from data centers coming in. It's a big boom. They think, it's like one of the biggest, manufacturing booms in quite some time. I saved that one for last because I've heard be some questions on that.
Any questions or comments?
Just a couple. Proponents that were presenting there, do they have any specific areas? Do they say, okay, we like northern Michigan, or we like the old Charlevoix nuclear plant or something like that?
Interestingly enough, we were made aware that when it comes to regulations for data centers, Michigan in the 48 states is one of the most stringent for data center. Exactly how, I don't.
Yeah, that's interesting. Yeah. And you mentioned those batteries. If these are giant lithium batteries, don't they get to like 3,000 degrees or some ridiculous temperature when they burn, and it's making it super hard to put out?
So the things about when these lithium ion batteries or other types of batteries, whatever the batteries are made out of, even older batteries, they burn until the energy that they have stored is dissipated, right? So like these cars, right? Electric cars, basically your floorboard is made up of all these, because they want the weight down low. Think of a AA size battery. Maybe it's a little bigger than that. They put a whole bunch of them together and make a little pack. And so a thermal runaway would be, so one gets breached, whatever, corrosion, it starts to heat up to the point where it's now degrading battery next to it. So that battery is starting to melt as this one's heating up. And that one actually catches fires. And the next one is, so it's a thermal runaway. So it's going to keep going until all the energy stored in those batteries are gone. And you can have several thousand of those little batteries in one vehicle. So last I was involved with data centers, they weren't using lithium ion. Think of your standard car battery, acid lead kind of stuff. Yep. But much bigger, right? We're talking some of the batteries were, and then they're all daisy chained together.
Okay. No, thank you.
Other questions or comments?
He mentioned that the village wants to test for PFAS. Was something triggered that made him want to do this?
Just
because that's an expensive test.
Yeah, they're thinking $500 to $800 for that test. No, it was just because that's in the news, and that well in the Village of Honor. That's always, I mean, it's a spring. A lot of people take water jugs and fill up there. I mean, almost every day you see someone filling up there. It's used quite a bit.
Just kind of,
Well,
why are you worried about it now?
well, the concern, think about this, Gary. The concern is that aquifer right there in the village. Almost every resident in the village has a well accessing the same thing. So if it's going to be testing positive for, you're talking about doing a whole spread of tests, not just PFAS. But if it comes back with any of these things, that means probably the whole village has these problems.
I wouldn't doubt it, but nothing's happened there that would cause me to think that that needs to be done. I mean, you don't have a shoe plant that uses PFAS to make waterproof boots. You don't have, other things that cause this or not cause this. If the fire department didn't put out a huge
Well, there has been fires in the village. This was all before I was on the fire department, but there have been some significant fires in that plaza and throughout the village as well over the years. Now, since I've been on the department, I know that foam has not really been used, and the foam that we do use is PFAS friendly. So, but prior to, I can't tell you what they were doing back in the, back in the 90s, 2000s. And it's something they said they'd rather find out now than down the road.
Guess it's their choice and their money, but it's just, okay. We didn't have a tire fire like they did in Blair Township. Anyway, thank you.
Just a couple comments. What I've felt is that the Village of Honor board is much more progressive than what they've seen in the past. So they're more forward thinking. With respect to the data centers, Tim and I had a conversation. I encouraged him to go to represent us. I talked to a couple of the attendees afterwards and unsolicited had some great things to say about your input. You're not saying this, but you're the one that brought up apparently the issue about the batteries. And the whole group, even those on the panel, were like, geez, we hadn't thought about that. In fact, rumor has it that you got cornered after the meeting and quite a few people wanted to talk to you about that. So
Immediately.
you represented us well, Tim. Thank you. Bob?
Thank you. Only a couple meetings since our last get together. Area Agency on Aging. It's a 10-county board of directors. Somebody's absent every meeting just because of the amount of people that are being there. Candy Landon is the regional director. She will be coming to see us sometime in the near future. It's I don't recall what the amount was last year, but every entity that's with them usually donates a certain amount of money. And I think it's in the $4,000 range. So I told her, come on down, see what we can get you. Some of you recall Doug Duran, who used to be part of the county and was one of the best in what he did for senior resources. His name came up at the meeting last week, and he was very, very highly respected in that arena. Had a great turnout at Memorial Day. The weather was good. Cannon was loud. And the 21 gun salute did its job. So very, very nicely attended. I appreciate everybody that was able to attend. Veterans Fairs yesterday. We primarily recouped what we did on Memorial Day and what we can do to make it better. And that's all I have. Village of Lake Ann tonight.
Questions for Bob?
We did get approached at the veterans about the aquatic center too, so if there's any
Yes,
help.
the gentleman was here
Yeah.
for some time, sat in the back row, and he's representing the aquatic center.
Oh, I know.
Mm-hmm. You heard it here.
Anything else? So I provided my report to you in advance. What I want to highlight is some of the platform issues that MAC is going to have this coming year. And I know some of you get some of these reports already based on committees you're on, but what I want to highlight here, because these are the things I've been talking to them about for a couple of years, is, we're hearing about property tax reform. I think it's good that we're looking at these things, but what's being ignored is what happens if you eliminate property tax? What is it replaced with? How does it affect the local communities? So that's especially in a market like ours. I've been talking sometime with this group also about what kind of revenue opportunity is there for collecting money from visitors on a bed tax that is being talked about now. The pushback, as you might guess, is from the tourism bureaus. They collect 5%. In order to streamline this and make things happen sooner, the discussion now is a portion of that 5% would be cut out for public safety rather than trying to create a new tax. Because we need to be able to pay for these things, but not on the backs of our local taxpayers now. We also were talking about properties that are no longer on the tax rolls. I have suggested now for a couple of years that we limit it to 40% per county at our discretion. And that is moving forward, whether anything happens with it or not. But initially it was being proposed just on state and federal land. They now have included the language to include aggregate of the conservancies also. We'll see where these things go. And the last piece is the PILT that's paid by federal and state government in our community. Some of those rates have not changed since the 80s, I think. It's been a very long time. It's time that we revisit that. That should be systematically increased, even if it's through a cost of living or inflation or whatever it is, but it stays stagnant for some time. Am I representing that right, Kelly? That it hasn't been increased? The PILT that's paid by state and federal. Well, yeah. Well, the proposal is that it's tied to a formula and done more systematically instead of just at whenever they decide to do that. And I'll end my report there. Any questions?
I like your 40%, but I think it's way too high. We've got way too much of the property that's not being taxed, that's not paying the freight. And I like the idea. I hope it has legs, but Conservancy, I don't know how the law is written, because they pretty much can control whatever they get into.
Well, currently it's comes under the IRS code, and that's how they get forgiveness from it. And quite frankly, how I arrived at the 40% is that's about where Benzie County is right now. And that seemed to be generally accepted. And more concerned, by the way, about counties north of Grand Rapids. No surprise, right?
Yeah.
But so we had to come to an agreement. 40% is what we landed on. Should it be something less? I could make that argument. Platte Township is at 60%. So,
Well, I'd like to guess what a Weldon's at. That's all pretty much state, not federal, but it's out of state.
these things will take us several years to work its way through. Katie?
All right, just a few things for me. So the 911 director process has kind of been touched on a little bit. We've received a couple of applications. There is a committee that was formed by the Dispatch Advisory Committee. Len sits on there, as well as the sheriff and Mike McGurr, who is the fire chief of Thompsonville. And then Leslie is also on that committee, and they'll be conducting interviews here soon. We did not receive a lot of applications, but we did receive a couple of applications. So we'll work through that process. The committee is they won't pick someone from the group if that person it doesn't really make the cut. They'll continue to try to advertise for those applications. We won't just take what we get just because, we're short-staffed. Rachel Wilson is filling in. She is helping. She's doing a wonderful job. Our office is trying to assist her as much as we can with some of those administrative tasks as well. So we are working through that process. We're not dragging our feet. It's just a matter of trying to get those applicants. It is a skilled position, and it needs somebody who's been in that space so that they kind of know the language and they know the process and those sorts of things. So we are working through that process and doing the best that we can. June 16th, as mentioned, the chamber is hosting an event on our behalf related to the August 4th proposal. They have asked for a panel of county folks, as well as somebody from the Tax Advisory Committee. So Kelly, myself, Michael Beach, and Jason Barnard are going to sit on a panel to answer questions. We'll be there from an educational standpoint, but if there's anything outside of that educational standpoint, we'll bow out of that part. But that is on June 16th. Also on June 16th, I'm going to go to the Gathering Place for lunch. I spoke with Kelly Ottinger about, should I do a formal presentation or should I just kind of, go around the room and chat with people? And she said it really is more effective to just be there, have lunch, and chat with folks versus doing this big formal presentation for that group. So my thought is to go there for the whole couple of hour lunch period and just, work my way around and talk to folks at the different tables and such and play games with them and just be part of that group for that couple of hours on the 16th. So looking forward to that. Let's see, I'm going down the list here. I will be out of the office on Thursday. My son is having surgery, so I'll be out on Thursday. Depending on how that goes, I'll be available on Friday. I plan to be here Friday unless something goes hairy, then I won't be here on Friday. Friday is the summer barbecue for staff. It's a potluck. So if anyone would like to come, bring a dish to pass. We do our summer barbecue. We usually do it in the paved parking area there behind the sheriff's office, and it's a great turnout. Hopefully there's no rain, but it'll be fun either way. I am presenting to the Frankfort Noon Rotary tomorrow. That is at the Frankfort Hotel on Main Street there. I've been doing this with the Frankfort Rotary every year since I've been here. Typically, it's more of a state of Benzie County. This year, it will continue to be a state of Benzie County. I'm just going to focus a little bit more on the general operating millage and the Headley reset and what that means. So that'll be tomorrow, and I think you're planning to go with me as well, right, Art? They're usually a really good group of folks down there. Just to announce to the public, it was also on social media. We are utilizing Pet Finder for the animals in our care now to try to get them more exposure online. So if there's folks looking for a pet dog or a cat is pretty much what we have. We are utilizing Pet Finder now, and we've received a lot of good feedback from the community on using that additional resource. So we're hoping that continues to be successful. It is a free service, so that's really cool. We're still working on revamping the animal control pages. We have the templates built and they're in the background. Now it's a matter of populating and just making them look and feel how we want them to look and feel. And then I also spoke with Kelly about adding a button onto their page related to donations. Many times folks want to donate to the animal shelter, whether it be for food and care of animals, and we don't really have a great way of doing that other than coming to Kelly's office to hand her money for that. We've been asked by a few groups and a few folks in the community about, is there a way I can just do it digitally? And so Shelter Love, which is the software that we use for the management of the animals up there, as far as intake and adoption and those sorts of things, they also offer a donate button, and they'll give you the dollars on whatever timeline you're asking for. Kelly and I talked about a weekly timeline for that if there's deposits. So we're working through that as well. And that was another request from the community as to things just to make things better. We are utilizing social media a bit again too from an animal control and shelter standpoint. And it's been positive feedback now. So I think that break was, you know, was a good break for everybody because social media is a wild place out there. And so, but it is going really well. We're putting lost pets on there. We also still have them on our website too. So we have a lost pets and an adoptable pets pages on our website. In addition to adoptable pets, will be on Pet Finder. So we won't put lost pets on Pet Finder. That's really for the adoption side of things. Other than that, things are going well up there, and Joe will give a more detailed report once he's had a little more time under his belt. He's only been with us just over a week, and so you know, he's still learning. He's doing a great job. He's really hit the ground running, which has been great. The staff seems to be going really, really well. He is rotating weekends. He's on call. And then as we work through that process of growing the staff, we'll ramp up to having somebody on call every weekend. So we have more of that 24/7 coverage happening in Benzie County, especially during the summer months when it gets a little wild around here. Leslie and I met with Gallagher. Gallagher is the benefits agent that we have moved to. We had a first look at some of the benefit renewals. We were very happy to learn that from a Priority Health standpoint, our renewal is looking at 7.5%. That's awesome. I know it sounds terrible because it used to, you know, gone are the days of 2%. So 7.5% is really great. Some of our neighboring counties are seeing double-digit renewals again. So we're very lucky in that sense. Also, you'll recall last year when we did some of our renewals, we were able to lock in some price guarantees. So for some of our other smaller benefits like dental and so forth, we have a lock-in guarantee until 2027. So from a benefits standpoint, we're looking really good compared to some of our neighboring counties from a renewal standpoint. But more to come on that. We have asked Gallagher to go to market for some of the ancillary benefits just to see what else is out there. As we work with some of these ancillary benefits, we're learning the vendors and the vendor shortfalls, and therefore we're just looking elsewhere to see what else is out there too, with either a cost savings or just a service improvement. I've also received the renewal notice for the MMRMA. So every year the MMRMA sends me a renewal questionnaire. And so I have to work through that questionnaire. The Sheriff's Office helps with that because there's details from them. Leslie will help with that from an HR standpoint. And we'll work through that renewal questionnaire. And then based on that questionnaire is how our renewal is partially determined. So that, and then our claims, of course, claims history too. You all are receiving those claims documents on a periodic basis. You get a monthly of what's been active or initiated. And so working through that process, we'll hopefully have the renewal numbers here in the next probably 45 days, which is really good from a budgeting standpoint. Last year, you may recall with the MMRMA, we were able to shift them to our fiscal year. So originally, MMRMA was January through December. And it always caused an issue for budgeting because we weren't getting those renewal numbers in time for budget adoption. So last year we were able to work with the MMRMA and do a condensed coverage year so that it follows the fiscal year. So when you see the insurance numbers this year, they're going to look a little different because the numbers are going to be quite different because we're going from we're going from a shorter coverage period to a full coverage period this year. And we did that on purpose so that we could align with the fiscal year. So from budgeting, we have more exact numbers, whereas before we were always kind of shooting in the dark because of the timing of those numbers. The only other thing I'll note is tomorrow is the last day of school for Benzie kids. And so just keep that in mind. There'll be lots of little tykes running around, more so than normal. And so that'll just add to the summer traffic and to just keep that in mind. And if there's any questions for me.
Questions?
The Headley Reset podcast, where are we at on that?
I have so Michael and I have a finalized script. We ordered the little microphones with like the fuzzy balls on top. I don't know. We ordered those. They're on the charger so that we can hopefully record that probably tomorrow. But everything is finalized. We just have to sit down and talk into those cute little microphones, and then we can get that published.
And then the barbecue. My first question was the chamber event for the Headley Reset. What time is that?
7.
7. Okay. And then the barbecue that you referenced, who pays for that?
The staff and admin.
So if commissioners wanted to chip in, you would welcome that.
Absolutely.
Okay.
Typically, our office will go get all the protein, And then all the staff brings dishes to pass, anything from chips to salads to cookies to all the things. So
Just didn't want folks, the taxpayer dollars.
taxpayer dollars are not paying for the potlucks that we have in Benzie County. The staff brings that together every year.
Your questions or comments? Katie, I got a little bit of a laundry list. Could you speak to the commissioner's role in ballot proposals? When can they encourage a vote versus just providing education?
Sure, I was going to speak to that this afternoon. We're talking about Headley,
Well, we can,
but we'll do it twice. So public dollars cannot be spent to campaign for an issue. So you as a commissioner on your own individual terms could advocate for a millage proposal. You cannot do it on the county's dime because that we're an educational standpoint only. So you as a commissioner, if you're meeting on a personal note with somebody or a group, not being paid a county per diem, receiving funds from the county or on your personal time, talking about it with your neighbors per se, you could advocate or not advocate for something. If you're doing something on the county's dime, so you're on a per diem specifically, and you're advocating for that proposal, that's a problem because county dollars can only be spent to educate on the proposal, not to go against or for the proposal. And so you have to think about that when you're talking about this and the audience that you're in front of and why you're in front of that audience when you're talking about the proposal specifically. You're at church on Sunday and you're there with your neighbors at church and they ask you questions in that setting. I'm not paying you to be at church. I'm not paying you to be a commissioner at church. You're there as, a citizen just like the rest of us, and you could advocate or not advocate for that. But if you're at a township meeting and I'm paying you a per diem and you're there on behalf of Benzie County as a commissioner being paid a per diem, you need to be in an educational setting at that point.
so with that said, the activity on June 16th, I'm going to encourage everybody to attend, but I would encourage you not to turn that in as a per diem because then we can ask for a yes vote as long as we're not being paid to be there.
Yeah, I will not, because part of my salary is to be there on behalf of the county. I will bow out of those conversations. Kelly and Michael will as well. We will, Kelly on her own accord can do just like you as an elected official. She can advocate. Myself and Michael, we cannot. And so that'll be when I bow out.
With respect to the senior resources, it's because there's not going to be a formal presentation. Do you want other commissioners there?
I would welcome you to come and be part of those conversations. I think my entire staff's going to go. So we'll probably close admin for hour and a half or so and go down there and, just talk about that different thing. Anyone else who would like to join us? My understanding is it's kind of just, it's lunch, right? And you're just meeting with the community. And so we were going to go be part of that group for that lunch period. So if anyone would like to come with me, I'd welcome it.
And I can't stress enough, as we've said for several months now, county employees should be educated well enough on this subject that they can talk intelligently about it when they're out in public.
Yes, anyone who has a question, they can come to me. I've talked about it at length with folks. I know Kelly has as well. So is Tammy. I mean, Tammy and Kim were just brainstorming things last week, and there's, added to my list of things we'll talk about this afternoon. So yeah, we're all talking about it. We're all trying our best to fully understand it, everyone to fully understand it, so that we can be confident in our conversations with our neighbors.
Okay, good. Jumping to a different subject, any updates on the recycling for Benzonia?
Not really. I know that Dave is working on an easement right now, and he's working on a location that could potentially be more long-term than just the summer months. He hasn't given me the name of that, and I think that was kind of because he was trying to secure the deal before publicly talking about things. So that is still in limbo, still working on that as soon as possible. And like I said, he's also trying to communicate with Joyfield and to initiate that process and go through that variance process as well. I will say to the public, there was an incident at the village of Beulah. The GFL truck did hit the pole, and that is because it is such a tight space down there. And because we're having to increase the amount of pickups that we're doing, that it's just room for error. So there was an incident. Nobody was hurt, but it's just one more thing on the list of does Beulah continue to host the site if you're going to have issues like hitting power poles and other things? So it's another thing to keep in mind as a community. If you can go to one of the larger sites, that's what we would prefer, because Beulah is already pretty compact.
Can I add something, Mr. Chairman?
Sure.
At the Joyfield meeting, even if we pay the $600 and start the process, I see that taking at least 3 months. So that's kind of, to me, not an option. And of course, the residents there all espoused that, well, we need recycling and we need it here local. So I'm a little concerned about their focus, I guess is how I'm just gonna put it, without getting in too much trouble. You know, I mean, if it was something that, because I think the township board has the right to override that. if They wanted to.
That's my understanding as well.
That's my understanding. So anyway, just wanted to throw that out there.
Well, Gary, because it's your district, anything you can do to help us further that, we'd appreciate it. You had talked about these ancillary insurance renewals and you said 2027. Is that January 2027 or fiscal year 27, 28?
Yeah, it's the plan year. And so they are open for change to their costs starting 10/1 of 27.
Yeah.
So it's for the plan year, which is our fiscal year.
And this is the month I think that we should expect information from MERS. Have you heard anything?
I have not. I don't have anything in my email. Usually they send out like a broad, your actuarial is available. And they have not done that yet. I was just in my email searching for that and we have not received that, but this is the timing. So we really should be receiving that anytime. The only thing that would cause a hiccup in timing is because they've moved to Empower for a lot of their record keeping and such. So I don't know if that'll delay it just a titch or not. But typically right about now is when we receive that actuarial and we have not as of right now.
Okay.
Mm-hmm.
Anything else? Then let's move on to the correspondence that you had in the packet. And I'll open it up to our last public comment period.
I'm Annie Browning. I live at 30 Grove Place in Frankfurt. And I'm disappointed that Christy's not here today, but I can share some things that have been going on for me in Frankfurt. Number one is I'm on the Zoning Board of Appeals there, which is really interesting for me to like be involved in things that people are arguing about there and just see how ordinances are enforced. Another thing that I'm involved with is I'm on the Planning Commission there, and I really like that. However, I'm also the recording secretary for the Planning Commission. So I have 2 roles there. And I asked Josh Mills when I was first appointed, what about conflict of interest? And he thought about it for a minute. He didn't think it would be a big deal. I now am meeting with Joanne Huerta on Monday to discuss it because I feel like it is a deal. Another thing that I'm working on personally in the city of Frankfurt, I have a dog there and he's great. He came from Grand Traverse Animal Control. He was seized as part of a felony animal abuse case. So he's a rescue in the true sense of the word. And I'm working with him to have healthy boundaries. One reason I say that is, and this is related to the county, I walk him on the trail connector there 3 times a day, I would say at least. And it's not uncommon that people, mainly it's older men, will go to pet him. They reach out to him and he kind of like freaks out and barks and lunges. And I kind of freak out too. So I bought him a harness that says do not pet. Remove that from the equation. So it's worked pretty well, but public service announcement to everybody, ask if you could pet a dog. That's my takeaway. So that's it. Thank you.
Thanks, Annie. Anybody else from the public that'd like to address the commissioners? Hearing none, we'll move for adjournment.
Move to adjourn.
I'll second.
All those in favor?
Aye.
Any opposed? All right, we'll see you back here at 1:30.